Testing, testing, 1, 2, 3. We need to get Mohammed and Tibet. You're good. So yeah, it's already on. It's on. Um, testing, testing. Yeah.
Are you standing going to be up here? Okay. Okay. No, if you're standing up, I'm going to give you a task
Well, I'm gonna get hooked with the microphone.
with the microphone. Okay. Because here, can you help with her?
Welcoming remarks. White's nine. Guys are going to do great. Oh, yeah. What do you think? I can do it from up there. I think I can use it.
So I only have two. Right there. Yeah, you can do it. Okay.
Just give me like some.
Well, look at that. Yeah, always incredible. Yeah.
Good morning.
Where are you from? Gaza. Oh, good. I've been talking about Gaza today.
One of our.
on, they know whatever, then we need to know. Okay, actually, gonna go. Wait, hold on, let's see. The office is here. I don't know. How that. No, but it's like taking a while to go off, see? Yeah.
Good morning. Good morning. I guess y'all can hear me. Let us begin this glorious day with a land acknowledgement, a practice which was introduced 2 years ago by one of our Peace Fellows. I invite Debbie Caramera, one of our second-year fellows, to come to the podium and give this acknowledgement that honors the indigenous people of our local region.
Good morning, everyone. Please join me in acknowledging the land we are gathered on here today. The Duke-UNC Rotary Peace Center recognizes that we are gathered today on the indigenous land of Okanichi Band of the Saponi Nation. We honor their elders, past and present, and give our gratitude for ways the Okanichi peoples have kept this land and their stories alive for generations. We extend this respect and acknowledgement to the continued presence of the Saponi people, a group that includes the Ino, Tutelo, Okanichi, and Shakori tribes, who are the traditional custodians of these lands, known as the Piedmont region of North Carolina. As guests on this land, we commit to treating it with the same respect, love, and care that the Okanichi Saponi people have shown across generations. Thank you.
Thank you, Debbie. As we gather today with a shared vision for a more peaceful world, my name is Newman Aguiar, and it is my honor to serve as the Rotary Host Area Coordinator for the Duke-UNC Rotary Peace Center, a program dedicated to shaping the next generation of peacebuilders. We are delighted that you are with us for our 23rd annual Spring Conference. We also welcome those individuals joining us remotely. The theme around which we gather today is building peace from the margins. As a courtesy to our presenters and your fellow guests, please take a moment to turn off or mute your cell phones or other noisy devices. You know, if Siri or Alexa decides to join the program, they'll be expected to make a significant contribution to the Rotary Foundation, and no exceptions for artificial intelligence. We are extremely fortunate to welcome Rotary Foundation Trustee Chair, Holger Kanak, here with us today. Holger has been a passionate supporter of our Peace Centers program and previously served as president of Rotary International. His entire bio is in your program, and I now invite Holger to share a few words.
Thank you very much, Newman, and thank you all. It's full house, it's unbelievable. You know, events like this is a wonderful opportunity for me to say thank you. To say thank you to the leadership of this university, to say thank you to all Rotarians who are supporting this program and supporting the students. And to thank you to all the students here in this room that you choose working for peace. Thank you so much for that. We all know it's terrible times right now, and working for peace was never as important as today, unfortunately. I worked with Peace Fellows since more than 15 years. It's exactly 15 years ago when I planned with 3 ladies in Germany, the first peace conference in Germany from Sakuchi Tanaka, who was president at that time. And all 3 I met again the last year. One was Annekia Reichert. She's running her own charity in Berlin, working for children from migrants. And the other one was Vicky Cochran. She comes from Australia, and she is working for a German foundation, Berko Foundation right now, and they are doing peace work in Somalia and Yemen. It's really hard work for them. And the third one was Brigitta from Messling, a German peace fellow. And I saw this year, the first time when we announced last year, when we announced the peace program in Colombia. And she's now in Colombia. She works for the United Nations. She's one of the observers for the peace contract in Colombia. She's in Cucuta, near the border to Venezuela, and is going to areas where no one else is allowed to do. This is peace work of its best, done by our Peace Fellows. And you, the 23rd class of Peace Fellows here, graduating here, congratulations. And I wish you all the best. And I wish you that you also have the opportunity to stay with Rotary in your coming years. This would be wonderful. Dear friends, I was visiting 4 peace centers. This is the 4th in the last couple of months. I was in Tokyo, in Australia, and was inaugurating the Peace Center in India, Symbiosis in Pune. And always we stand near to a peace pole there. You know, we have peace poles nearly everywhere. But my own view on peace poles is, at least, it doesn't mean nothing. Nothing if they are not seen as a reminder that we have to do more for peace. Otherwise, as I said, it's nothing. But it's a good reminder for us simply to do more for peace on so many different levels, and all of us can contribute to peace. And my wish to Rotarians here in this room, all of us can contribute to our peace program. This is a signature program of Rotary International, and this is also Working for Peace, a good opportunity for all of us to support this wonderful group of young people. Thank you so much, and let's have some fun here. Thank you.
Thank you, Holger. We truly appreciate you being here with us today. It means a lot. I now ask the members of the Duke-UNC Rotary Peace Center Board to stand and be recognized. Jonathan Abels, Managing Director. Susan Carroll, Director Emerita. Sharon Thomas, UNC. Carol Allen, Rotary Representative. Thomas Lassiter, Program Coordinator. Our faculty directors, Catherine Adcock-Admey at Duke, and Suzanne Maman at UNC. Our co-directors emeritus, Francis Letham from Duke, and Jim Peacock from UNC. And our two alumni representatives, Karina Ito from Class 8 alumna who lives in Brazil, and Carlos Juarez Cruz, Class 13 alumnus who lives in Mexico. If you have a chance to meet any of these individuals, please thank them for the inspiration and steadfast support they offer our Peace Center program. In addition to our Peace Center board and honored guests, we have several additional current and past Rotary leaders with us today. Our Peace Center would not exist but for the commitment over many years of past and present Rotary leadership in creating and sustaining the Rotary Peace Center program. Today we have with us Rotary International Director Patrick Eakes and Kristen. Would you please stand? Past Rotary International Director Ken Morgan. Past Rotary International Director Peter Kyle. Peter. Past Rotary International Director Vicky Poulis. And Rotary International Director-elect Tom Gump. If we have any other current, past, or incoming directors or trustees, would you please stand and be recognized? Anyone here that I missed? Great. A very special thank you to the current governors from districts across North Carolina for helping sponsor this event. First, let me introduce Rotary District 7710 Governor Lisa Higginbotham and Jeff. And her classmates who are watching remotely, Rotary District 7720 Governor Brownie Futrell. Rotary District 7670 Governor Alpo Portelli. Rotary District 7680 Governor Donna Moffitt. And Rotary District 7690 Governor Mark Brandon. Also with us, we have Zone 33 Regional Rotary Foundation Coordinator, Bernie Rydell. Rotary Peace Center's Program Director, Laura Desher. Rotary Foundation Major Gifts Officer, Lori Menzel. Rotary Foundation Major Gifts Officer John Teisch, and Rotary Foundation Campaign Coordinator Kate McCullough. We have several past district governors and other Rotary leaders with us, but time does not permit me to recognize each of them individually. So would you all just please stand and be recognized? We're also honored to have some Peace Fellow alumni in the room. Any Peace Fellow alumni, would you please stand? During the break, I encourage you to connect with them and learn firsthand how their work continues to shape communities around the world. Thank you all for joining us here today. Throughout the term of their fellowship, each of our Peace Fellows is matched with a local Rotarian who serves as the Fellow's Rotary Host Counselor. Our Rotary Host Counselors and their families help our Fellows get settled upon their arrival, navigate and understand our customs and traditions, and remain a friendly resource for them throughout their 2 years of study. We have in the audience a number of current and former host Rotarians and families, and I invite them to briefly stand so we can acknowledge their important contributions to this program. Please stand. Thank you for all that you do to enrich the lives of our fellows. With your presence here today, you have the privilege of hearing from our second-year fellows, who will soon be graduating and moving on to the next phase of their careers. During their presentations, you will hear a variety of viewpoints. You might or might not agree with some of their points of view. But please remember that everyone is entitled to their individual view, and that courteous discourse is the key element of conflict avoidance and resolution. I now would like to invite John Abels to come up and introduce our first-year fellows and to cover some important information. Let's launch into an unforgettable day.
Thank you, Newman, and thank you, Holger, for your kind words. Well, welcome everyone. It is as we say, a full house, and people will continue to come in. We had a little challenge when we learned late last fall that there was something called Savannah Banana, which I did not know, but my colleague Tom did, and he says, "Oh my gosh, 50,000 people are coming to Chapel Hill today to watch a sold-out game." So I'm just glad Rotarians like to start early. All right, we have wonderful presentations for you today. We're going to have 3 panels throughout the day, and each panel will have 4 fellows in our second year presenting, and we'll have them present in succession and then join to sit up here in the front to take questions from the audience, and each one will be moderated. So I ask you to, if you'd like to ask a question, just please raise your hand and the moderator will choose you, and then someone on the side, one of our fellows, will run a mic up to you. I know some of you might think, I can speak very loudly, but we want to make sure that people online can hear your question too. So if you could wait for the mic. And then the second thing, and this is really hard, don't ask 4 questions and don't ask follow-up questions. Simply because, not because we're not interested, but because we want to make sure that everyone has a chance to ask a question, that as many as we can fit in the period that we have. So for those that say, oh, I really have that burning question. Guess what? We have a box for you. It's outside the door, and you're invited to write the question you want, that you have, that's burning, that you would like addressed by the fellow or by the presentation that you heard, or to Tom or to me or to anyone about the events of the day. Please put them in there, and we'll follow up with you after the conference. Of course, we need your email address to do that, so don't forget to do that. After the first panel, we'll have our first coffee break, and that'll be 30 minutes, or what it can be to get us to time. But I wanted to tell you that at that time, there'll be a coffee, tea station, water on the first floor and also on the second floor. And you can access the second floor also in the back corner of the auditorium. So if you're halfway up the stairs, you can also choose to go just climb the stairs and go out that way and find the station there or down below. That will be the same that's true at lunchtime. So we'll have a buffet line upstairs and one downstairs. There's more tables downstairs, but there's a line upstairs as well. And at each table over lunch, we'll have a current fellow or an alum or member of our advisory board assigned each table. There's a placard so you can see who's sitting at the table and you can join them. And especially if you want to follow up with something about you heard in their presentation today, or you're interested to know more about their poster that you might have seen, please take a seat there and enjoy the conversation. The restrooms are located upstairs, outside the doors, and then also out here around to the right on both levels. So we have a full schedule and need to keep to time so that all presenters have the opportunity to present. So we appreciate you responding to Carol's bell when you hear it ring. Now, before we start our first panel, I want to introduce Trey, our photographer. Come on up, Trey. We're going to document this event by taking a group picture. All right, so Trey's going to get up here and take a group picture, and then we're going to take a selfie, because we need to have a selfie, of course, whenever we get together, right? So, Trey, whenever you're ready, we'll do that. Yeah. Show some exuberance that you're here at 9:05 on Saturday. No, do you want to stand? I don't think we do. No, Trey, no standing. No. Yeah. Trey's great. All right, selfie time. So if you want a picture with your Rotary fellow, or you want a picture with your friends, grab Trey. He'll take a picture for you. All right, I'm getting instruction here. All right, did that look, Trey? I'm gonna take a picture of the instruction. All right, that's all right, there. Okay, right. One smile. All right, raise your hands like you're happy.
Awesome.
Thank you.
Awesome.
Thank you. You're a wonderful audience. Okay. Now, with the program. The program's in your schedule with the details of the topics. We've arranged the presentations by theme, and you can read the bios of all the fellows in the program, both in class 23 and class 24. So this first theme is changing the narrative, and our first speaker is Mohammed. Come on up, Mohammed.
Busy crowd, huh? Get some water. Yes. Good morning. As many of you know, North Carolina's agriculture depends on hundreds of thousands of farm workers who plant, tend, and harvest the food on our tables every season. But the rural communities where this work happens are facing a healthcare crisis, one that most people never see. In this presentation, I will share what my field work revealed about healthcare access in rural Western North Carolina. Draw on lessons from humanitarian settings, and present actions we can take together to help close this gap. My name is Mohammed Fakhri. I'm a physician and a public health professional from Yemen. Let me take you there, to Yemen. Since 2014, my home country has been engulfed in civil war, a conflict that has destroyed hospitals, displaced millions, and created what the United Nations has called the world's worst humanitarian crisis. Today, close to 20 million people need humanitarian assistance. That is more than half the country's population. And before coming to the United States, I managed health programs in war-affected Yemen. And I once stood in an emergency department and watched a young woman in her 20s arrive with no signs of life. Her family had done what any family would do. They tried to get her to a hospital, but the nearest one was hours away, and the system had collapsed around her long before she got sick. She did not die from a disease. She died from distance. That moment planted the seed, one that slowly reshaped how I understand my role as a physician, how I understood my role as a physician. I couldn't save people from a broken system at the bedside. I had to go upstream. That is what brought me to public health. This is what going upstream looked like. Working with the International Committee of the Red Cross, making sure that even prisoners of war had access to healthcare, but the seed kept growing. At Gillings, the School of Public Health here at UNC, we embrace the idea that global is local and local is global. I traveled across the world to study global health, only to find that the crisis was right here. So let me show you what that actually looks like on the ground. In the summer of 2025, I did field work in Western North Carolina. See how beautiful it is. But in these farms that I visited, I lost cell service completely. I stood in fields doing the math on what a medical emergency would look like. Who would you call? How long would it take? Would it actually matter? Since 2006, 12 rural hospitals in North Carolina, nearly 1 in 5 have closed their doors to inpatient care or shut down completely. 10 more are at financial risk, and 6 face immediate risk within the next 2 to 3 years. Across the United States, over 700 rural hospitals are at risk of closure. Rural communities across Western North Carolina are losing access to primary care, mental health services, and emergency medicine. Residents are driving hours for basic appointments. And for the more than 150,000 farm workers in the state, the picture is even worse. Across the country, 80% of farm worker families with children have no transportation. 85% of farm workers in the US have no health insurance. 9 out of 10 children in farm worker families are uninsured. 40% are depressed and 30% experience anxiety. not because of individual circumstances, in my opinion, but because of isolation, separation from family, and the reality of being essential to everyone except the systems designed to protect them. And if you are undocumented, every single one of these barriers is compounded. So as we just saw, this is not one state's problem. It is Appalachia, the farmlands right here. It is rural California, South Carolina, communities across the country. And it is Yemen, South Sudan, Bangladesh, Ethiopia, everywhere distance separates people from care. From the farms of North Carolina to the conflict zones of Yemen, distance kills when we look away. The people who keep our grocery stores stocked and our fridges full are often unable to access or afford the care they need. The cost of our food is not only measured in dollars. It is measured in the physical and emotional toll already paid by those laboring behind the scenes. Now, why call this a peace issue? Because I have seen what happens when health becomes the last bridge standing. From Yemen to Western North Carolina, the pattern is the same. In my work with the International Committee of the Red Cross, the ICRC, in Yemen, I learned that health is often the only neutral entry point in a conflict. When we visited detention facilities, we were not just delivering care. We were building trust between groups that had none. Health built bridges that nothing else could. Here in North Carolina, there is no war, but there is what the literature calls structural violence. When social structures, not weapons, systematically prevent people from meeting their basic needs. Decisions, policies, absences that have made entire communities harder to reach, harder to see, and harder to serve. Now, John Galtung, a Norwegian sociologist and the principal founder of the discipline of peace and conflict studies, described positive peace as the presence of social justice, equal rights, and functioning institutions, a definition which Rotary International adopted. By that definition, what I witnessed in rural North Carolina is not peace. Unfortunately, it is a quiet emergency, but not a hopeless one. Here is where Rotary can step in. In Yemen, health was the only bridge across armed conflict, armed violence. In North Carolina, the violence is different. It is structural, but health can be the bridge here too. And we know how to build it. So what can we actually do? There is no single solution, but we know what works as part of an answer. Mobile clinics, for example, work. Community health workers work. Culturally competent care works. And this is not wishful thinking. Evidence backs all three. Mobile clinics save nearly $1,000 per patient per year. Community health, everywhere they have been tried in rural America, people got healthier. And when a patient sees a provider who speaks their language, they are 70% less likely to be harmed and half as likely to die. So the question is not whether we know how to fix this. The question is whether we decide these communities are worth the investment. This is a mobile clinic. It is operated by Vecinos, a farm worker health program in Western North Carolina. It shows up where no one else does. It speaks the language, it earns the trust, it meets people where they are, because the system will not come to them. I have been on this clinic. I have watched it do what the entire system would not. And when I walked around the back, there it was, the Rotary wheel. The Rotary Club of Cashiers Valley. Do we have anyone from the Rotary Club of Cashiers Valley here? Well, next year they should be here, I guess. 500 miles from here, on a dirt road no GPS could find, the fellowship that sent me to study the problem had already been funding solutions. It was a full circle moment. Now I want to be very clear about something. I'm not asking you to step away from anything Rotary is already doing. Clean water, polio eradication, literacy, peace, the environment, all of it matters. What I'm saying is that rural health access belongs on that list. It is not a detour. It's not a distraction. It is the same principle that no one should suffer because of where they were born. This is about adding one more lens to the work you are already doing. We are already doing. So here is what that looks like in practice. Simply get informed. Talk to your legislators about rural health funding. Volunteer with community-led initiatives that are already reaching these communities. Partner with organizations like Vecinos that are doing this work on the ground. And fund what is working and help scale it. And I should have added to the list, hire me. Because peace building not only happens at a negotiating table. Sometimes it happens on a dirt road in Western North Carolina when someone takes a clinic to a community that has been waiting far too long for the system to arrive. Thank you. Thank you.
Hold on. Mohammed. You raised the bar. I'll try my best with my flat platform. Wow, good morning again. My name is Deba Babate. I'm from Ethiopia. I'm a Master's International Development Policy student from Duke. Go Blue. And I'm a Rotary Peace Fellow. And for the next 12 minutes, I'm going to ask you one of the most uncomfortable questions. And it starts with, okay. No, I don't have a clock. Yes, sorry. And it starts with this. What if we've been building peace all wrong? Think about it. What if all our efforts, the treaties, the diplomacy, the dialogue, what if all starts way, way too late? questioning everything 3 weeks before graduation. Nice move. But we're here, right? And today we're going to talk about a different foundation for peace, one that has been overlooked for quite some time. It's not a place, it's not a community, it is time, the first 1,000 days of a human life. This journey started in a health clinic in Ethiopia for me. Early in my career, I worked for an international NGO, and we've been treating severely malnourished children. Every children were getting the same exact food. The same protocols were followed to the letter for every single kid. But after a while, a pattern starts to emerge, something that doesn't make any medical sense. Some were bouncing back, healing really fast. Some just weren't. And that left a question with all of us. What are we missing here? The answer actually, wasn't in a syringe or a cabinet. It was right there in the room. These children didn't just need calories. They needed connection, the profound sense of safety that only comes from a consistent, loving human bond. They needed their caregiver too. That left me was one question. If that bond can literally change the child's biology, what else can it change? That question set me on a search for a huge missing piece in what we do, especially peacebuilding. I had spent over a decade in humanitarian assistance, development, and peacebuilding. And everywhere I went, I kept hitting the same wall. Caregiving was powerful and present in every community I worked in, but in our platforms, in our frameworks, completely absent. It never got a seat at the table. Let me show you what they kept missing. This is an Ethiopian traditional baby shower. We call it Gat. The woman in red was weeks away from giving birth. And yet, everyone in her community was already there to say to a child who has not yet arrived, you belong, you are already seen, you are loved. Let me ask you this. How many children are welcomed into that kind of safety? And how many weren't? Why has something this foundational, this visible in every community has been so easy for our conventional peace frameworks to overlook? That image, it never left me. And when Rotary Peace Fellow brought me to Duke, I finally had the tools to understand why. I dove into peace frameworks, theories, models, pillars, and boy, we have a lot of those. And when I went through all of them, one thing became obvious. There's one picture that's almost always missing from every single one. Think about when we always picture, when we talk about peace, high-stake negotiations, diplomacy, governance reforms, all crucial. I'm not here to dismiss them, but they all share one same blind spot: the caregiver and the child. They completely ignore how the people inside these systems are built in the first place. They miss the very first foundation of what it takes to be a peaceful human being. Our approach to peace is like an iceberg. We pour all our time, our energy, our money into what we can see, the tip, sticking out of the water. Conflict, military spending, dialogue, negotiations. But underneath, we ignore the stress on a caregiver who is wiring a baby's brain either for fear or for safety. The stability of a family environment. We ignore what's happening in the first 1,000 days. Let me break it down just a little bit. According to the 2025 Global Peace Index, the cost of violence to global economy in 2024 was almost $20 trillion. 20 trillion. And what did the world spend on peace building and peacekeeping to prevent it? close to $49 billion. That is, for every dollar spent to violence or lost to violence, we are willing to spend close to 6 cents to prevent it. Here are another uncomfortable question for you. Of those $49 billion, how much do you think went to the first 1,000 days or caregiving? 0. Nothing. There's no budget line for it. Nowhere in the global peace framework architecture does it exist. Not even a rounding error. When you look at our conventional peace architecture, in our models with all their pillars and everything, you can see the flaw clearly. The people pillar is treated like just one piece of a puzzle. It is not seen as foundation of all others, and it starts way, way too late. And peace that begins in kindergarten is already years behind schedule. And this is not just the philosophy that I'm talking about here. I looked at the science too. Harvard Center on Developing Child is very clear about that. Chronic stress in the first 1,000 days physically rewires a child developing brain, empathy, trust, the ability to sit across from an enemy and not reach for a weapon. These may look like soft skills, but they are the architecture of peace, and we lose them in the first 1,000 days. I looked at the economies too. I mean, with $20 trillion on the table, who wouldn't? Nobel Peace Laureate James Lauren proves that for every dollar invested in the first 1,000 days, society gets a return up to $13. $13. He's telling us that this is not just a compassion, rather a smartest investment any one of us could make. This evidence led to my core of my master's project. I called it the Peace Person's Model. It does two things that current peace frameworks don't. It treats people at the foundation, and it starts at the beginning, in the first 1,000 days. Level 1 is secure caregiving, the foundation. This is when a child first learns, is the world safe enough to trust? Level 2 is the relational trust, the capacity to connect. This is when the skills that would make a peaceful coexistence possible is built. And only then, the one we usually focus on comes to flourish. Institutions, governance, agreements, the parts we all love to fund. But to tell you the truth, you cannot build level 3 without building level 1. Peace follows human development, always. This is what I knew and what I finally understood. For over a decade in Ethiopia, I saw caregiving as a beautiful tradition, something we did because of who we are, because of God. This fellowship and my study at Duke changed everything for me. I realized that what I thought as just tradition is a biological and social prevention. And those first 1,000 days aren't just a medical window. They are peace window. I went from a health clinic asking what we were missing to a baby shower that had known the answer all along, to seeing the foundation of a global peace policy. And I know this prevention, this perspective can change everything for Rotary too. Because Rotary already knows this logic. The prevention is your legacy. Think about polio. You didn't wait for a child to be paralyzed to act. You went to the source. And we are now on the verge of eradicating polio from the face of the earth. How cool is that? And yes, as a Rotary Peace Fellow, I'm allowed to brag about that. My argument, the prevention logic must be applied to the roots of violence as well. Violence has its own incubation period as well. It's time to move from a biological prevention to social prevention. So, we have the blueprint. How do we start building? 3 things for now. 1, let's reframe our grants. Next time you review a global grant for maternal health or nutrition, ask these 2 questions. Does this project strengthen caregiver-child bond? Does it build social cohesion? If yes, that's a peace project. fund it, but track it as well. 2, activate our peace centers. Work with universities and peace fellows to prove the return or caregiving for peace in the first 1,000 days. Secure bond in year 1 prevents conflict in year 20. 3, mobilize the network. 1.4 million members, a club in nearly every country. Use it to scale models that start in the first 1,000 days, before the trauma, before the fracture. I'm not suggesting abandoning to what we've been doing so far. What I'm suggesting is let's do it early. Well, a lot early. This is how we build. But let me leave you with the why. Everything a child experiences is internalized. What they carry inside is what they bring out into the world. People are built, peace is built on people, and people are built early. And if peace has a starting point, it starts there. Thank you.
Oh, the logo. Thank you, sir.
How is the nation of the bomb of the saved? This was, I just want to go to that.
Good morning. Can you see me? Yeah. Oh, so fast. The person you are seeing is actually an indigenous person. Some of you have never seen the original African. I am the original African from the jungle of Uganda. Happy to see you here. I'm a bit local. I will not really present. You will see from my slide that I'm a little bit traditional. And my name is Oliver. Indeed, it is an honor and indeed a privilege to be here today to speak to, I've never spoken to a number of people like this, intellectuals. So you'll hear some changes in my voices because it has been a long time since I campaigned to be a local representative in my constituency and I failed. So this is my first time to talk to a group of intellectuals. Today, as we observe the octave of Easter, a season of renewal and hope, I stand before you, not only as a Rotary Peace Fellow, but also as a committed stakeholder in environmental conservation. And of course, peace building, because environment and peace building go hand in hand. I am humbled to share a reflection on this topic, advancing conservation for peaceful coexistence. The last time I checked, coexistent means harmony. How do we conserve the environment and utilize it in harmony? I chose the topic because of 2 reasons. One, because environmental conservation is a key pillar of Rotary International. And secondly, because of my touch with the indigenous people whose land has been taken away by some of these conservation initiatives. We are a forest-based community. So I stand before you, not to share a story, but a voice of people neglected, a voice of people not heard of. And indeed, you are a contributor to their instability. Because the government of Uganda
which is a smaller country that really no people know about. The last time I checked, when I was in Cataract country, please forgive my pronunciation. The only thing people know about Uganda was a chaotic period in time during the leadership of one president called Idi Amin. That is what people recall a lot. But this is a small country sandwiched in Africa. You can see that small dot. And it is also known as the Pearl of Africa. I don't know why it was called that. I think that pearl has been destroyed. Very small, comparable to a state of Oregon here, but with a population of 45 million. Can you imagine? A small area of land occupying such big number and such a government who want to really implement conservation. Where will people stay? Where will people cultivate? The area is known as a place rich in biodiversity, flora and fauna. And actually that is what makes Uganda stand out in Africa. You can see 19,000 species of plants, animals, etc. That is what really drive people to visit Uganda. So I also welcome you, please come visit Uganda. Thank you. But there is this problem. Yes, conservation is good. Good to who? Conservation is good to you who is doing the conservation because you are doing it at the expense of people who rely on those forests for their livelihood, for their survival. How are you a participant in the displacement that is happening in Uganda? I may ask you one question. How did you come here? Did you use electric car? Did you ride a bicycle? You came either flying or driving automobile. You are contributing to the climate change because of the carbon that you release. And the solution is the land-based carbon sink, which is the forest. That is where the government of Uganda, being a poor country, has rushed to that. It's the only way to get money from you, the polluters, and ensure that they do some development activities in their countries. Because of this, the government has failed to look at the local indigenous people. Their focus now is how to create big chunk of forests in order to get that money. As of last year, $31 million was given for a verified carbon sink in a forest in my area. So which government in Africa, a poor country, will really look at the local people? Yet there is some money coming as carbon financing. Some money is coming to offset some of the carbon. So the focus is actually now on extending lands and pushing away the people who live at the margins of this protected area. The second one is you visitors. You visit our country, excellent. See what you are doing. You are contributing a lot to our economy. 3% of our GDP is from your visitation. Please come visit Uganda. Employment of 800,000. Please come visit Uganda. Who are the managers of this place that are always focusing on only forest and ignoring the people? These are the culprits. Uganda Wildlife Management Authority, managing all these sites, parks, reserves, sanctuaries, and the like, using very strict legal regimes, and actually some of the international framework created by some of you in this room. Sorry for that. The current conservation approaches in Uganda actually does not look at human beings as actually a necessity. It is not like I have observed here in the United States, where human and parks coexist. In Uganda, it is total exclusion. Parks policies are so strict that if you enter a park, you are considered an encroacher. And you will not come back alive. The only time you come back alive when you enter a park is when you're a visitor, because you're bringing in resources. If you are not a visitor, you are considered a poacher, and you are supposed to be shot on target. Our parks and conservation areas are manned by the military and militarized game rangers who are supposed to scout the area day and night, ensure there are no human beings, and especially the local ones who will interfere with the area. And as such, it has led to this whole problem that we now call conservation-led displacement. What you see here are actually some of the key hotspots where there has been continuous displacement of indigenous people from their area. Displacement without notice, displacement without compensation, displacement without rehabilitation. The Batwa community is one of the indigenous people. I believe some of you have heard about them. Just in a span of 10 years, they have lost their land. 6,200 people evicted. The Benet, 18,000 evicted. The Ik community, which happens to be the community that I come from, 10,000 people evicted out of a population. We are a very small community. That community actually is lesser than 15. We are a small community of 15,000 human beings. We have been dispossessed. Even me who is talking, I now live in another area far away from that, about 100 miles away from my original homeland, in the name of conservation. These are some of the impact, colleagues and friends, and these are just not really, it's just not an evidence picture. These are lived realities. The picture you see down there, you know, in Africa, sometimes when a community is overwhelmed, men are rendered useless. Women use their bodies as a weapon of protest. So you see them there, they are stripped naked in front of authorities that have come to evict them. What you see up there is actually a group of people. The picture doesn't actually include a number of shacks on this side. These are people who are displaced, and they have lived in such kind of shack for over years. And they have to fend for themselves without water, without any assistance. So they are just destitute. You live in that and look for some work in people's garden. This is my setting. This grass-touched, whatever. Displaced away from their original home, now they have sought sanctuary in an area that doesn't even support production. We are agriculturalists. Just because you are seeking for where to stay. People are pushed to already existing areas which are having already people. And that has resulted into a lot of land disputes. This is what the process to chair say. Not only were Benet violently evicted from the forest and robbed of their ancestral home, but today, decades later, they are still living in temporary settlements made of empty huts of mud and stick, deprived of essential services such as clean water, electricity, healthcare, and education. And that is what is happening till now. The problem is cyclical, from weak governance, policies, leading to displacement, and displacement foments conflict. So there has been a cycle of conflict upon conflict, conflict with authority, conflict among the community, because they are struggling for the scarce land resources. Tale from corner are like becoming a refugee, being forcefully ousted from one's land and habitat by immediate is disruptive and painful, but also becoming poorer than before displacement, more vulnerable economically and disoriented socially. What needs to change? One, the government and stakeholders in conservation should recognize and protect indigenous land rights. There must be security of tenure to the indigenous people. Next is provision of access to remedy and reparation, especially for the people who have already been evicted and having nowhere to stay. And we are saying that in case of any eviction or conservation-related eviction, there must be a human lens where eviction should be conducted with a human right lens. This has worked in other areas, but the approach has changed. It's called community-based natural resource management. This recognizes the rights of the people on land, recognize their wisdom, which is called indigenous knowledge, in managing such forested areas. And it is only being practiced in Namibia. And we are asking the government of Uganda, please borrow some idea from Namibia, ensure that the local people are stewards of their resources, because that is where their livelihood is based. To conclude, ladies and gentlemen, conservation should be built on inclusion, equity, and respect for rights. Let us act now to recognize indigenous peoples, restore ancestral land, and support displaced communities in rebuilding sustainable livelihoods and living with dignity for a just and peaceful society. Thank you, and may God bless you. Hallelujah. Thank you.
Morning again. So, let me start. Yes, can you hear me fine? My name is Hanan. I'm a physician and a public health practitioner. I am from Ethiopia. And as you all know, I'm a Rotary Peace Fellow. And today, I'd like to start with a story. It started with a cow. In August 2019, in a small rural village in Ethiopia called Wala Kabale, a cow had gone missing for several days. When the family finally found it, it was sick, weak, shivering, unable to walk. And like many families, they made a decision. They slaughtered the animal and shared the meat across the village. More than 20 households consumed the meat. Within days, people began to get sick. Vomiting, diarrhea, high fever, and that night, 8 patients arrived at the hospital at once. One of them was already in a coma, and one had died at home. And we had no idea what was going on. We didn't have the tools to find out why this was happening. Orsa was a small primary hospital in Ethiopia. It had about 200 beds, 1 emergency room, 4 outpatient rooms, and it served nearly 250,000 people. Yet it had no advanced laboratory capacity, no imaging beyond basic X-ray, and no infectious disease specialists. When emergencies happened in that district, SAGA was often the only option. And that night, we collected blood and serum samples from patients, but we couldn't test them in SAGA. There was no capacity for confirmatory diagnostics. The samples had to be transported to the capital city, a journey of about 200 miles, requiring cold chain, maintenance, and reliable transport. We waited days for confirmation while making treatment decisions based on clinical suspicion alone. We started empiric antibiotics, hoping we were right. We began investigating, we interviewed patients, families, and we traveled to the village, a journey that required a tractor because there were no paved roads. What we found confirmed our fears. The cow had shown clear signs of illness before slaughter, classic signs of anthrax infection. But without veterinary guidance, the family didn't recognize the danger. We traced the exposure across the village. Of the households that consumed the meat, 36 people became ill. In a village of 180, that is an attack rate of 200 per 1,000. And here's what made it worse. This had happened before. In the same village, a similar outbreak has killed many people. The pattern repeated because the underlying conditions never changed. Standing in that village, talking to families, seeing the disconnect between what happened and what could have been prevented, I understood something clearly. We were treating a human disease outbreak, but the problem began with an animal. The solution required veterinary intervention, community education, and coordinated surveillance, none of which were in place. We were reactive. And by the time humans got sick, it was already too late to prevent the outbreak. We were not ready. To understand what happened, you have to understand the reality of life in rural southwestern Ethiopia. Most families depend on livestock for their livelihood. A single cow can feed a household, fund a child's education, or serve as the only safety net a family has. Veterinary services are scarce. Many communities have limited access to animal vaccination or disease surveillance. When an animal gets sick, families often don't know why, and they cannot afford to let the meat go to waste. So they eat it, sometimes cooked, sometimes raw, which is traditional in many parts of Ethiopia. This is not ignorance. This is survival under constraint. It is the result of a system that asks people to make impossible choices between immediate survival and invisible risk. And most of us would make the same choice. And this is where zoonotic disease transmission begins, at the intersection of poverty, limited services, and impossible choices. And a zoonotic disease is a disease that spreads between animals and humans. And in this case, it moved from the environment to the animal through food and into people. Anthrax is just one example. In Ethiopia, we face multiple zoonotic threats: rabies transmitted through dog bites, brucellosis from livestock and unpasteurized dairy, avian influenza from poultry, and Rift Valley fever linked to environmental and climate conditions. These are not rare diseases. Rabies alone kills thousands per year, and they all emerge at the same intersection: human health, animal health, and the environment. Globally, 75% of emerging infectious diseases are zoonotic. That's not a small number. Every year, these diseases are responsible for an estimated 2.5 billion infections and 2.7 million deaths. We've seen this with COVID-19, Ebola, Marburg, and other diseases that emerge at the intersection of humans, animals, and the environment. They're not isolated events, they are patterns. And those patterns point to one thing: connection. Connection between humans, animals, and the environment. That's the foundation of One Health. That's why organizations like World Health Organization, World Organization for Animal Health, the Food and Agriculture Organization of the United Nations, and UN environmental programs are working together under the One Health approach to strengthen coordination across human, animal, and the environment. That experience in Sakka stayed with me. It raised a question I couldn't let go. What would it look like if systems actually worked together? That question brought me to the United States for a training in applied epidemiology, where I learned how surveillance systems can detect outbreaks early, how data integration enables rapid response, and how coordination saves lives. Here in the US, I saw how systems can work: coordinated surveillance, real-time data sharing, and cross-sector collaboration. For example, the CDC's One Health Office and NC State's One Health Collaborative are already bringing sectors together. So progress is happening. But even here, coordination is still a work in progress. That's when I connected everything I had seen, Ethiopia, the US, my training, and the Rotary, and I realized the gap is not knowledge. The gap is coordination. Through Rotary, I learned health is not just technical. It is a peace issue. When systems fail, trust breaks. And when systems work, stability grows. This is where my work aligns with most of Rotary's 7 areas of focus: promoting peace, fighting disease, improving water and sanitation, supporting maternal and child health, advancing education, strengthening local economies, and protecting the environment. Rotarians are already doing this. What's missing is coordination. And that is the gap One Health fills. Systems don't run themselves, people do. And the most important investment we can make is in the people on the front lines. The health workers, veterinarians, local responders who detect outbreaks early, prevent transmission, and connect systems when it matters most. And by the way, that is me. When systems fail, communities pay the price. Trust breaks, but when systems work, trust builds, stability builds. And that is what One Health makes possible. Not just better health, but stronger, more resilient communities. Let me take you back to August 2019. The same village, the same cow, but this time, a different system is in place. The cow is vaccinated, the outbreak never begins, or the risk is recognized early and the meat is never consumed. Or the outbreak is detected early or quickly and a coordinated response begins. And some of those patients, including the child in a coma and the person who died, receive care in time. This is not a different story. This is the same story with coordination and resources. One Health is how we get there. Not separate systems, but one system working together. That is how we prevent the next outbreak. That is how we build trust, and that is how we build peace. So I leave you with this: invest in people, strengthen coordination, and support the communities closest to the problem. Thank you.
Yeah.
Yes.
Yeah. You will guess. Okay.
Okay. Wonderful. Thank you so much. Let's give one more huge round of applause. What an amazing start to our conference. And I think the story they tell shows you how much they've been enriched from the learning they've gotten at UNC and Duke. But what it doesn't tell is how much we've been enriched. And our students at both institutions are enriched by having these amazing fellows within our program. So just acknowledging how much they contribute to our learning as well. So I'm going to moderate today's session. I want to give a little bit of an overview or my synthesis of what we just heard, and then I'll open it up with a question and then open it up for the audience. So collectively, these 4 presentations ask us to really reconsider where peace, health, and stability begin, and where they often quietly unravel across very different contexts, from North Carolina farms to early childhood development in Ethiopia, from conservation policy in Uganda to zoonotic disease outbreaks in Ethiopia. We see shared roots of the problem. The most consequential drivers of conflict, suffering, and instability are often structural and preventable. They sit not only in moments of crisis, but in the systems we build, the policies we put in place, and the communities that we do or do not include. Our fellows in this session highlight distance as a central theme, not just physical distance from care or services, but moral and political distance, decisions made far from the people who really bear the consequences. They also challenge us to confront the blind spots. Early childhood, indigenous rights, local health systems, and human and animal environment interactions that sit outside the traditional peace or development frameworks, yet are really fundamentally shaping whether societies experience peace at all. What binds these presentations together is a shift from reactive to preventive thinking. Peace here is not framed as the absence of war, but is really built early, built locally, and built with people. Rotary's emphasis on service, prevention, partnership, and long-term impact is evidence across all 4 of these talks. They collectively challenge us to ask not only where Rotary funds or supports, but how early we fund, with whom, and according to whose priorities. They invite us to see peace building not as abstract diplomacy, but as something that must happen through investments in people, systems, and communities long before conflict ever becomes visible. So with that, I want to open it up with a question that I'm going to ask each of you to respond to briefly. We have only, I want to make sure everyone has a chance to ask questions. So, but I'll get us started with, many of you highlighted the consequences of exclusion. And so I want to ask you, from your experience, what really characterized genuine inclusion? And what are the risks when systems move forward without it? So in the context of your talks, what really characterizes inclusion? And what happens if we don't have that and move forward without it?
Well, thank you. Been an excellent question. Thanks a lot. Inclusion, exclusion is when you fail to involve the lowest stakeholders in decision making, meaning that they are completely not part of whatever decisions that a particular government or organization is making. Like in the case for Uganda, when you don't involve the least, the grassroots, as part of the stakeholders in the conservation, completely you have knocked them out and they will always be the one to face the consequences. Thank you.
We have a new way of using the mics, so. I think sometimes we talk about inclusion or exclusion as well. We talk in very rhetoric way, but to simplify things, if you don't include everyone, you are harming yourself. Let's take an example of protecting people from disease. If you think that by, for example, vaccinating 2 or 3 of those who have access to immunizations, for example, but there are people or communities excluded, you're not protecting yourself. So you have to include them even if they are not on your budget, for example. So to be very pragmatic, even if you don't care about these people, even if you don't want to help these people, if you want really to help yourself, you would include everyone on board. So everyone gets a chance and you will be protected as well. So it's very important to include everyone first because of you want to ensure welfare for everyone, but at the same time to be very pragmatic if you want to be, and include everyone for your own safety and for your own self, whether it's community-based approaches, whether it's farms, whether it's diseases, everything. If you want to reach everyone and protect yourself first.
Thank you for that question. I think it's really important, I think for me, especially I would say, when you talk about inclusion, it usually comes with some sort of feature. It has to be like a human being or some community members or a place. And I feel like time has been really invisible when it comes to peace building, because when you talk about peace building, we always think about these big things that we see, these huge agendas that are crafted for many, many months for any UN or AU meetings. But then again, when you think about it, it's the people that are actually sitting there that are doing these huge decisions, who have never had the same kind of experience that we want them to do, for them to have that empathy, that trust, for them to actually be able to have those discussions and then have a room of negotiations. And I feel like that has been excluded from our interventions. And the more we do that, the more we bring people in, the more we let them have the trust and the empathy in them, they would be open for any kind of compromise, any kind of conversation. It will always lead to some sort of connection, some sort of goal, and how I see that.
Thank you. For me, I think I see inclusion at the systems level. In my context, like organizations working for peace and development, and not only public health, actually have different priorities set. For instance, healthcare setups, they have patient outcome as their major priority. Let's say veterinary medicine, they have, their animal health as a priority, or agricultural services, they have their priority to improve food safety or like improve their system. So each organization and each system has their own priority set. So for me, inclusion means to design a policy that can actually help coordinate the systems and design a policy to help fight the barriers of working in collaboration. For instance, there are various policies that hinder easy data sharing, privacy issues. So we can have a system that allows integration of data that makes the environment or like the working situation easier for collaboration and for better outcomes. And that's how I see inclusion, like designing a way to actually have different systems to work together.
Well, thank you. Let's open it up for the audience now to engage with these scholars. And please, if we can get the microphone, I see it right here in the middle. Pass the mic.
Hi, real simple question that won't be easy to answer. What is the number 1 aha moment, your biggest takeaway from this entire experience?
I'm going to start that.
I think in this 2 years, the biggest thing that I learned is to be able to think in systems. It may sound like I'm repeating myself, but it is really the major takeaway for me. Before I came here, I used to think like to improve public health, for instance, I would only need to improve the hospitals or like train more professionals or, you know, just focus on healthcare. But that doesn't take us anywhere. That doesn't get us anywhere. We need to improve the surrounding and like the environment that actually enables us to actually bring about change in sustainability and like long-lasting peace and development. So to be able to think in system is the biggest takeaway for me. And they taught us really good on that too, so.
I think for me, the biggest takeaway would be, so before coming here, I did work with a lot of NGOs, and a lot of my time was like fighting on policies. You need to have these policies, you need to have these. At some point, I decided that maybe I should go there and you know, learn a lot of policies and how it's been built. And I came in and I actually understood like, we're actually really, really late. Like what we do, what we are building, what we are crafting, that is actually late. And when you go into everything that we have right now as a policy, as a strategy, you could call anything. It could be peace, it could be food security, it could be nutrition, it could be anything. When you look at it, it's a lot late. And the problem that I'm seeing is, again, with the whole inclusion, it's a very good question, is nobody thinks about time being excluded. Like we always think about people or place. And I wanted to bring that into people that time can also be excluded. So we need to think about that. It should be part of that list, that we have a long list of excluded things that we always talk about, we always think about. Time has to be included in that as well.
For me, when I moved from Yemen to the US and being here within the triangle, and every time I move between my house to the School of Public Health, I see the big, beautiful hospitals, the UNC hospital, and we have the Duke Hospital here. I was like, wow, this is America. This is the United States. And I should learn from how they manage things and how they build big hospitals. They have bright minds, great doctors, great services. But the moment I went to rural Western North Carolina, I was like, wow, this is Yemen. So first I was thinking I should learn from here, but then I was like, they should learn from us as well. So that that experience was an eye-opening one, that we should share experiences because we have so many similarities. We are good at something, people, different places are good at something, we share knowledge, we try to make good in this world. So that was the very eye-opening moment that I realized that things can be different within the same country, within the same state, one of the wealthiest countries in the world, and yet you see some exclusions in these communities. So that was the eye-opening moment for me.
For me, actually, having worked with refugees for several years and now working as a civil servant, there is something that is missing. The people we intend to be serving are always not heard. So my takeaway is, whenever there is an intervention, even with the Rotary-related projects, the people that you are serving might be suffering silently. I have been in Uganda all my life, and this is my first time talking about displacement. I have been in the sector actually contributing to the displacement, but I could not see it. Now it is because I am here and learn a few things. I am now here talking, oh, displacement. But I have been facilitate displacement. So I think the biggest takeaway is the people that we serve need to be heard, whether it is vaccination, whether it is environmental, whatever, all the people actually have something to share with us. Who seems to be helping them? There is one thing they always have that they can share with us. Thank you.
Thank you for your amazing presentations, thought-provoking. I'd like to ask your advice for those of us in the room. Rotary International and individual Rotary and Rotaract clubs have a platform. How can we better use that platform to highlight what may be invisible communities? I think one of the key threads through all of your presentations, you were dealing with invisible communities or communities who had significant access barriers, both to power structure, to goods and services. How can we better use our platform to help highlight those communities?
Well, thanks a lot for that excellent question. Just a few, before we started this presentation, I was interacting with one of the Rotary members. And I was telling him that the area that I come from doesn't have a Rotary club. And now that I am a Peace Fellow, a Rotary Peace Fellow, there has been pressure building up on me that when are you finishing? Come and what? And start a club in our what? In our district. So I think we have looked at meetings as the only point of interaction and sharing Rotary values. But I think actually having a platform. I know there is an alumni platform where they always meet once, but we really need a platform where we place there our specific Rotary Club views and challenges that we go through. I think there is need really for maybe, I don't know whether Rotary International can open like where we can like a website where there is a dashboard where districts can place their opinions and challenges. I think that is really something that will keep us up to speed and also enable us to learn from what other Rotary clubs are doing. Thank you.
Having worked with the International Committee of the Red Cross, we had one of our main themes within the health department was to make the invisible visible. So don't wait for it to come to you. Don't wait for people to voice out their concerns. Go to these communities. Take the clinic to them. Take the services to them. Take the microphone to them. Don't think that people will come and grab the microphone and speak up, make a noise or something like that. Some communities and in some traditions, people need to be invited because of so many years of being silent, so many years and decades of being excluded, so many years of, they think this is the norm. So when you go break the silence, you go and give them the opportunity to talk, give them the opportunity to be seen, give them the opportunity to be visible to the system. You take the system to them if the system, if they are not able to come to the system. As we saw, 80% of farm worker families, they don't have transportation, for example. So what's the solution? We take the system to them. We take the auditorium to them. We take our media platforms to them. So it's a two-way stream. Please don't expect people, because there is a hospital, people will come to it. Because there is a school, people will come to it. You need to go to them, to reach them, because they think, so many times people think the normal is to be excluded and no one would hear.
I think I would say, since there has been an aha moment for me as well, like to see time has been also excluded, that awareness has to start. That could happen in anywhere. Like it could be your clubs that you would do, like club meetings. You can invite people to actually let them know, have the awareness that time can also be excluded, and we have to start doing early. And I heard an experience from my host family, Lisa and Jeff Higginbottom. I think last week we had Easter dinner together, and they're telling me about the McDonald house that the Rotary Peace Club, the Lisa is managing, is now planning to work with them in making sure that there is a safe place for mothers that come from far, a lot of them states, for them to have a space and a food and a place to stay when they are, with their kids, when they're going through different kind of treatments. I mean, it could start in those small things, in small places. But I would say the first thing is creating the awareness for them to know that has been a problem in our system, and you need to know about it. And when people know, I'm sure they will act.
So in the past 2 years, I've been to so many Rotary clubs. I've given presentations. I've heard so many presentations there too, mostly like global grant project reports. So I would say, even though the question is really tough to answer, I would say when you do like global grant project reports, focus on the people, the stories, and not just the number and the money spent and the outcome and the actual magnitude of change. I would say like we should pivot more to the personal stories, the lives we touched, the individual lives we touched. And Rotarians are all over the world. There are millions of us, I can say, but now I'm almost graduating. So that's a lot of clubs worldwide too, with numerous global grants. And that's thousands of lives changed. So we can use our reports to tell their stories, highlight their stories, highlight those communities, in addition to the Rotary Peace Fellowship, which every year takes in 10, 11 students, each come from different communities with different stories to tell. So I talked about one story today, but I have so many others. So keep doing the Rotary Peace Fellowship. Also, the global grants are excellent, but the storytelling should be emphasized, I think.
Okay, my eye was caught by maybe our youngest audience member who has a question I see here. So this is our very last question, and then we'll break for coffee. Yeah.
Good morning. My question is, I saw in one of those slides for Uganda, I saw one of the men, like they were defending the place, the parks, but why would they stop their own like brothers in blood from going to the park? Like why would they kill their own brothers?
Sorry, while you are there, can I add one more question? Oh.
Thank you for that very good question. You see where the world is moving. All eyes of governments actually looking at resources in terms of money. So at this point, they have discovered that there is money in conservation. So they are doing all it takes through policies and through the military, ensure that these resources are protected from human interaction. So the value is actually they're looking at the money. In terms of what we have mentioned here, climate change, carbon, you know that the forest takes a lot of carbon dioxide. So the polluters are looking at that, okay, let's give some of our money to these people so that they can conserve the forest, so that the forest can capture carbon dioxide, which is a big contributor to climate change and global warming. And secondly, these same conservation areas provide employment. So the government will look at you, one person, or you, a small community like mine, we are just about 15,000. Say, this community is actually contributing very less to the what? To the economy. Why can't we just drive them out, since we are expecting thousands of dollars from this environment? So that is actually what is happening. The government is driving people away, ensure that this area that is a contributor to the country's economy is preserved, and that has been really the case. But what we are advocating here is, why can't it be inclusive? Why can't human beings, they have been interacting with these areas and they have been surviving, because that forest is their source of livelihood. Like the case we have pointed in Zambia, there must be interaction, but here, because they're using extremely exclusive approaches, that doesn't really allow human interaction. That is why I am here today to say, please, using your Twitter handle, Facebook, whatever it is, just type there, respect the rights of indigenous people. Forests is their source of livelihood. And research has shown that communities that benefit from the forest seldomly destroy it. People who destroy indigenous people's forests actually come from outside. So instead of the governments and policymakers focusing on those outsiders who come to invade this forest, they are now looking inwardly. And I think it's something that got to change. Thank you.
I think with that, we'll go ahead and close this session and invite you to coffee. I know there are a lot more questions, but John pointed out there's a box. You can drop them there or find these fine scholars at coffee. Thank you.
Cheers, thank you.
Okay, so you're like. Wait, so. Oh, that's it. No, there, sorry. Oh, right, okay. That's fine. You're good. Yeah. I mean, if there is, if it is only just like a battery, plug it in, then we can do it. I say we wait till. I'm
Oh, thank you. That's very kind. How you doing?
good. How are you?
Good, good.
Tom.
Rory,
Nice to meet
lovely
you.
to meet you. Lovely to meet you. From which club?
Minneapolis, Minnesota.
Oh,
So I'm
nice.
in.
Sorry, I turned this off so it's not broadcasting. No, no, you're fine, you're fine.
Test, test, test.
Can everyone please take their seats? We're going to get started. All right. All right. You can't hear me. All right. Yes. It's just a loud. All right. Tom, put it to 11. Put it to 11, Tom. All right. All right. Can everyone please take their seats?
Gentlemen, by the way, what an amazing event. So happy.
I'm going to announce your thing.
Thank you.
I was told the microphone wasn't working, but it just had more competition. So can we give a round of applause to our first panel again? It's just going to keep getting better and better. All right. Before we start, I just want to call out an event that's going to happen next weekend that we are co-sponsoring here at Chapel Hill, in case you are local. Peace in Perspective, an interdisciplinary symposium at UNC Chapel Hill. It's been arranged by Professor Bill Billman. Just stand there for a minute, Bill. Thank you. Brian, right. His brother's Bill. Brian, and it's arranged by he's an anthropologist and a professor, and it's arranged by the undergraduates, and it's a historical perspective through multiple disciplines. And so there's some handouts out there so you can learn more information about that. Oh, that mic works better and better. Okay, Tom, I knew you're holding back on me on that. Okay, we're ready to start the next one, and this one is called Empowering the Communities. And we're going to start with Rory.
Thank you. Thank you very much. It's really hard to follow those first four, so we'll see. See how we do. Welcome back. Everyone's energized. That's really great. Let's get cracking. So, for most of human history, we know that being part of a group or the act of gathering meant safety and survival. To prepare for today, I've had the joy of reading through a range of books on this to sort of familiarize myself with the rich tradition of that. To know, it's personally quite grounding for me to know that all of these books come to a very similar conclusion, which is that when we come together, we're able to overcome a lot more than we would if we were to be divided. I find that grounding personally, but also for my work. It kind of flips the script on the narrative that we have this predisposition, or we're predetermined to be at war with one another in our communities and elsewhere. So for the next 11 minutes, I want to explore something that might seem obvious, which is that how we bring people together and build trust is one of the most practical ways we can contribute to peace. Not abstract peace or peace far away, but peace in our own communities. This is a very simple calculation, and it's at the core, I think, of what a lot of us have been talking about today, but also the reason we're here today. So this morning, I want to share some of my own learning from this, from my experiences across Europe, but also my learnings from this time as a Peace Fellow. Specifically, to share lessons from the practice of gathering at times when trust in my own community or communities I'm part of have been extremely low. I think you know something about that here in the US too, here in North Carolina. So it's not too, I have to explain too much what's going on here, but it's quite sobering. Nearly, or more than 4 in 5 rather, Americans say they're exhausted by division. You might know something about that. The majority are genuinely worried about political divisions. That's courtesy of Fox News. And finally, a significant number of Americans see people on the other side not just as wrong, but as a threat to their way of life. It's a very dangerous place to be. I'm sure you'll agree. It's also easy to see this data and reports like this, and also to live this in your own lives and feel the need to retreat into more close and familiar circles. But since we're at a peace conference and I'm here to talk about the art of gathering, we can't do that. I'm going to suggest that now is the right time, is really the only time that we should start thinking more intentionally about how we gather, about how we bring people in from the margins of our own lives, whether we've marginalized them ourselves or they've marginalized us. In other words, I'd like to talk about how to avoid the urge to isolate ourselves from those we've disagreed with, or sometimes felt the need to marginalize ourselves from, and how to begin the process of proactively rebuilding trust through intentional gathering. These images oh, nice. That's good. That could have been really awkward if we just stood here for 10 minutes waiting for them. These images are a reminder that coming together across deep division is nothing new. As a species, we are remarkably good at it, even after immense hardship and suffering. What these moments don't show, what the cameras don't show, is everything that came before. The weeks, months, and years of relationship building. The conversations that didn't go so well. The slow, unglamorous room of creating enough trust to even be in the room in the first place. The great Nelson Mandela said it best, and he understood this more than most. This quote is from his memoir, and it stays with me. Both sides regarded discussions as a sign of weakness and betrayal, but there are times when a leader must move ahead of the flock. I don't think he's describing or just describing leadership at the nation state level. I think he's talking about something much more everyday. The willingness to move toward the conversation before everyone else is ready. That's something I've been learning and thinking back to in my own work. And for me, that started with something called TCFT. It's a intergenerational program for young people, artists, mentors, community leaders across Europe. We meet for sometimes a day, sometimes 2 weeks, and we're hosted in communities across Europe, sometimes communities that have gone through extreme hardship. For 12 years of that work has taught me that bringing people together across difference is genuinely an art form. It requires real partnerships, constant learning, and a particular kind of humility. That's the reflex of asking who we're excluding to our conversation in the panel, of trusting others to lead, and of listening more than we speak. It's hard for people like me. And then there's food, my favorite part. We cook together, we eat together, and sit alongside one another, before, during, after workshops. Participants and facilitators alike. It won't surprise you to know that some of the most important work in relationship building in TCFT and in diplomacy happens over food. And part of that for TCFT is that we've been hosted in places like Italy and the Balkans, where the food is really good. It's really easy to do that. But also, like mealtime, this work is messy sometimes. It doesn't always work. But hosting these large residencies, particularly in places like Srebrenica, has taught me a lot of lessons. And those lessons became really valuable in my own country, in my own community, when Brexit arrived. For us in TCFT, and those of us who are proud of our British and European identities, Brexit was a wake-up call. In the months and years following that vote, a lot of our work had shifted. Not by accident, but because we felt it was important to strengthen our links with partners across Europe, to continue building bridges between communities. But we also know that we had a lot of work to do at home. So a lot of that learning in post-conflict settings became really useful. This is where Priya Parker's book, The Art of Gathering, came in for me. It's a great book, and I strongly recommend it. There are so many gems in this book, but one that stuck with me is that a lot of the work of peace building and the work of gathering begins before you've even got people through the room. It's about the expectations that you set before they arrive. So the need for you to be clear about the purpose of that gathering in the first place. So during the Brexit years, we had to get clear about our purpose as an organization. We weren't there to debate Brexit. We certainly weren't there to change anyone's mind on the vote that they'd already cast. But we were there because we were genuinely worried about what happens to a community once you stop the ability to talk to one another, or if you just keep arguing every time you do. For us, that was the honest answer of our purpose. And it turns out a lot of people, thank you, a lot of people in Dorset shared that concern, even if we didn't agree, and even if we weren't on the same side of the political spectrum, or even the same side of that binary leave or remain vote. But like everywhere else, once we got in the room, we built trust first, we shared food, and we created. I personally learned so much from that, and I think this is why this might be relevant to some of the stuff that's going on here in the US. About 4 years after Brexit, not really related to Brexit, I moved to London and started a job at the US Embassy in the ambassador's office in London. I was very curious at the time about diplomacy and the way that nation states come together, the way that they gather. I thought I had a lot to learn about that. What I found when I started that job and through organizing ambassadors' roundtables, receptions, convenings of all sorts, was that the work was very, very, very familiar to the work that I've been doing in Dorset and elsewhere. It was about building trust. It was about setting expectations before people came to the room. It was about welcoming everybody and checking who's at the fringes of the room in any kind of event, reception, who's on the margins. I learned in both worlds that it was important to create the conditions for people to want to come in the first place. That's in the way that you invite people, the way that you host them, the way that you welcome them. It's important once they're in the room to be open to dialogue. It's really important to not cast your own view and opinions on them before they've even set foot in the room. Let them have a space and let them come into it first. Also, most important of all, was to leave room for people to come back next time, even if there was a difficult conversation, even if negotiations didn't go well, to create the space for people to want to come back, to continue the conversation next time. I also learned, quite importantly, at the embassy, the need to understand the limits and the reach of your convening power as an organization or an individual, and how solid partnerships and unlikely alliances can help with that. As a Peace Fellow, I've been fortunate to spend time thinking more about this, grappling of the question of how we gather, and to better understand how each and every one of us, even the introverts, have the capacity to convene. Also, if you're a bit exhausted, completely understandable. This is where I think Priya Parker's book comes in. Priya says in her book that sometimes gathering less for shorter amounts of time, but with more intentional rituals, is all that's needed. If you feel busy and overwhelmed, step back and think about the purpose of what you're doing, the purpose of every encounter you have. In Priya's book, she talks about birthday parties, meetings, business meetings, all being the same. You think about the purpose, you think about why you're inviting people into the room. It'll be a lot easier to have conversations in them, especially the difficult ones. So reflecting on my time at the embassy and TCFT and my time as a Peace Fellow, I wanted to share some thoughts with everybody in the room. I think we're all pretty good. We're all here on a Saturday convening, gathering, so I don't need to sell you on the purpose of that. But there are things I think we can all do in our own lives, in our own communities, in our Rotary clubs that we can do to make that much easier to reach more people. Number one is understand your convening power. Every organization, every club has something they can offer that others can't. Understand that and embrace it. Number two, find a partner or a community leader that shares the same hope for dialogue, even if there are disagreements. In fact, especially if there are disagreements. Number three, never lead with the difficult conversations. Build the space first, create the conditions for trust, and then have the conversation. Number four, build an accessibility from the start. Regularly reflect on when you meet, where you meet, and the cost that has on the person coming, particularly financial cost, social cost, and emotional cost. Number five, my favorite, use food. It's really easy. This one speaks for itself. If the food is really good, people come back. Also, if it's really bad, people talk about it, and it's something to connect on. And lastly, be consistent. This is the hard bit. Trust isn't always built in one meeting. In fact, it rarely is. It's built by showing up again and again and again. If you're like me and you want to keep learning on this, I'd love to talk at the end if we could share emails. I've got a list of books and things to send you. Forgot to do a QR code, sorry about that. But there are so many resources out there. People are thinking about this and grappling with these questions all the time. People at all levels of society from all backgrounds. So I appreciate the opportunity to share some of this with you today. I share this knowing and also assuming mostly that everybody here and people joining from home knows how precious it can be to gather and how much easier it is to overcome differences once we have. Mohammed said in the panel earlier, which I really liked, that in some communities and traditions, you need to invite people. You need to be the one to proactively bring them in. I agree with that completely. And I think also that applies to people that you've marginalized from your own life, perhaps because you have a political difference, perhaps because you voted a different way. And I do firmly believe from work in Brexit, in diplomacy, that now, especially right now, especially in North Carolina, is a particularly good time for us to start thinking about rebuilding trust in that way. Thank you.
Yes. Yeah. Thank you. Thank you. Good morning, everyone. Is it audible? Yes. Perfect. Seems like I missed it. It's good. It's good. Yeah. Hello, everyone. I'm Nish, a Rotary Peace Fellow from Nepal. And today I'm going to share you my story of building creative people power. Born and raised in Nepal, I witnessed injustice from a very young age. Through caste system, class system, gender disparity, and unequal power distribution between power holders and duty bearers. To resolve this injustice, Maoists had declared civil war in Nepal in 1996 and was using terror and violence. My father himself was tortured and jailed by the government, whereas my father-in-law, when treating wounded Maoists, was interrogated by military. And even today, it is so difficult for me and my partner to talk about those incidents of our childhood. And we think, if it is so difficult for us, what kind of difficulties that kids have to go through whose family were killed during that time? Also, for me, Maoist conflict was contradictory. In search of positive peace, which is justice, equity, transformation, they had jeopardized what Nepal already had, a negative peace, which is absence of violence. And while growing up, I used to always ask to myself, can the use of violence by oppressed people lead to justice for them? Or does it simply reproduce new form of injustices? Good thing is that in 2006, civil war ended, and Maoists were in charge of government in no time. But the deeper question remained, did justice actually arrive to the people who was oppressed by the system? To find this answer, after my high school, I traveled to several villages of Nepal, stayed with the communities, and tried to understand what did they face during the Maoist conflict period and in post-conflict era in Nepal. I witnessed that even after several years of the ending of civil war, people were living in more or less similar conditions. Nothing had changed in their lives. There was immense discrimination, poverty, and oppression in the grassroots of Nepal. And also the bits and pieces of conflicts were still remaining. Lots of smaller groups had weapons from the civil war period. And most importantly, the mindset of political parties hadn't changed. Political parties still believed that they could win power and maybe the hearts and minds of people through violence and force. Therefore, they were using violent methods to demand change, demand right, which in contrary was creating more injustice, keeping more people at risk, making more families apart. And again, those living at the margins were the ones who suffered the most. And as someone who was affected by violent conflict myself, I was, of course, a big proponent of nonviolence. I started a nonviolent movement called Anti-Banda campaign, which is basically a general strike, countering the general strike. I was basically protesting the violent way of protest, and I was urging political parties to use nonviolent methods. The more I started campaigning, the more I was fascinated by the concept of nonviolence and started learning more about it. One thing that struck to me that Whenever there is an injustice, people organize, whether through violent or non-violent way. They organize to counter injustice. The only question is, do they have non-violent or violent mindset? Non-violent or violent leadership or structure? Doing more research, I noticed that though political movements were using violent methods, a lot of social movements in the grassroots were still using non-violent tactics. They were resisting injustice practices, but in a peaceful manner. So this made me interested to learn why don't we hear about these movements? Why nobody talks about these peaceful movements that they have been existing in local level for years and years? Why their pain and struggles has been invisible? Why these movements were fragmented, even though their demands were similar to the violent movements? And then I realized that there was a fundamental problem in nonviolence resistance and nonviolent movements. I started doing more and more research, and I found out that there were two major gaps in grassroots movements of Nepal, social movements of Nepal. Often for the research can be generalized in many of the other contexts around the world. The first gap was strategic gap. These movements have had high energy and commitment, but their leaders lack a clear plan for sustained impact over time. Their leaders were good at engaging people quickly, but faced a significant challenge in driving change. They responded to events after the event happened, rather than planning ahead to shape outcomes. Movements with similar goals and constituencies were acting separately without strong collaboration or alignment. And they were not able to expand their movement to create a broader systemic impact in their community. And the second gap that I noticed was the creative gap. These movements were still using same old tactics used in 20th century, but like new media has already come, technology has evolved, they lacked the innovative approach to stand out. They were also struggling to communicate compelling narrative that inspired people to join their movement. They didn't fully use social media or online tools to amplify and impact their movement. They failed to resonate with people outside their core supporters. And they were having trouble expanding visibility and attracting wider people's attention. So I began searching for something that I could bridge this gap. And then I found artivism. Artivism is a unique practice of combining strategy and creativity. Artivism is not only about art, it is not only about activism, it's a fusion of both strategy and creativity, the connection between head and heart, between plan and emotion. In 2020, together with my partner, who is actually sitting in the third row in the right-hand side there, I co-founded an organization called Freedom Studio, which basically works to expand freedom and justice movement by providing strategic and creative supports to the social movements. We believe that emancipation of marginalized and exploited community is possible through nonviolent creative mobilization. Since then, we have worked with several social movements in Nepal and around the world using artivism as a tool for social change. And over the last 6 years, we have noticed that artivism works. It works to build people power, emotions, and connection. It makes movement visible. Communities all around the world have long raised their voice against injustices, discrimination, yet their voices are often not heard and are confined with their own communities. Art helps amplify this lived experience through storytelling, reaching broader audience and evoking emotional engagement among their supporters. Through songs, visuals, and stories, it can spark the feeling of humor, anger, or empathy. As artivism uses images, stories, and symbols, people across different literacy level and languages can engage, where technical language or policy language fails to do that. Artivism also helps building feeling that are apart from the shared communities. And most importantly, artivism is about imagining change. Not only pointing out what's wrong, but asking how can be things done differently. This is really important because people are more likely to take action when they can actually picture a better future. This is an example of a local artivism campaign that I, along with my team, did in Nepal to address littering on our trekking trails in Nepal. As a major destination for mountain climbers, many trails are increasingly polluted with waste left behind by tourists. A team of 33 young people from Freedom Studio undertook a week-long trek to Mardi Himal, one of the mountains in Nepal, collecting plastic waste, which we later transformed into a trashman costume that I wore while walking back from the base camp to the city. It's a part of our public awareness raising. The second example is a use of theater of oppressed, an artivism tool that Freedom Studio promotes. Through this approach, we encourage audience of a play, of a drama, to become a spectator, actively participating in the performance, to imagine and rehearse alternative future. This method transforms passive viewers into engaged participants, creating a space to critically reflect on operation and explore possibilities for change. In August 2024, I came to Duke as a Rotary Peace Fellow with two major questions. How does development actually work? And what role does creativity play in it? At Duke, I learned that development is political, not just technical. It's about power, who decides and who benefits. It's non-linear and contested every time, and is largely shaped by narratives and institutions. Also, I began to see that creativity is also at the center of development, not only at movement building. Because creativity plays a vital role in shaping narratives, mobilizing people, challenging power, and imagining alternatives. Today, we are facing rising inequality, polarization, and injustice across the world, including here in the United States. To resolve this, as a peace builder, as a policymaker, as an activist, is not alone enough. We need new ways to connect, new ways to mobilize, new ways to imagine change. So I want to leave you with this. I believe that everyone in this room is an artist. Maybe you write, maybe you sing, maybe you design dance or film, maybe you just tell a story. Your creativity is not separate from change. It's a tool for change. So don't just consume art, create it. Whenever you witness injustice, express it. And if something moves you, let it move you into the action. Because real change happens when strategy meets creativity. Thank you very much.
Good morning, everyone. My name is Debbie, and today I'm going to take you on a journey to explore how Gacaca courts, a community-based approach led to peace building in Rwanda. As I share this presentation, today marks 4 days after the beginning of the 32nd commemoration of the 1994 genocide against the Tutsi in Rwanda. My first encounter with the deeper meaning of a tree was in 2016, when I heard the story of a client who found healing not through formal interventions, but by speaking to a tree behind her house, a space that offered safety, consistency, and non-judgment. That moment challenged my thinking beyond conventional frameworks and recognized that meaningful healing can emerge in spaces we often overlook, yet hold profound significance to an individual. The fig tree you see in front of you, in my local language, Kinyarwanda, is called umuvumu. This tree carries deep cultural significance to Rwandans. In times of crisis, such as drought, or before a war, rituals were performed under this tree, and over time, it came to be sacred. While modern systems often prioritize mass production, indigenous knowledge remains rooted in harmony and with nature, just like this tree. But it also reminds us the importance of valuing and investing in knowledge systems that are grounded in lived experiences. So for a long time, systems of social work have often been shaped by frameworks that don't always reflect lived experiences, histories, and cultures of communities in the global South. Yet concepts such as healing, justice, and reconciliation cannot simply be imported. They must be grounded in the realities of people. And this is where indigenous knowledge matters. It becomes important, not as an alternative, but as something essential. Unfortunately, indigenous knowledge is often misunderstood as backward, rural, and unscientific. Yet in reality, it's place-based, it's collective, it's holistic, and very adaptable. On April 7th, 1994, marked the beginning of the 1994 genocide against the Tutsi in my country. Within 100 days, over 1 million Tutsis were systematically exterminated by a Hutu extremist government. What were once socio-economic groups became rigid ethnic categories. Colonial systems institutionalized these identities, making them hierarchical and deeply divisive, which resulted to the 1994 genocide against the Tutsi. In 1996, the Rwandan government began the long-awaited genocide trials. The delay was due to the fact that the country had lost most of its judicial personnel, not to mention the destruction of courts, jails, and other infrastructure. By 2000, there were over 100,000 suspects, genocide suspects, awaiting trial. And at the time, we had also 150,000 detainees, and Rwanda's prisons could only accommodate 12,000. Gacaca, which means on the grass in my local language, is rooted in an indigenous Rwandan knowledge systems, where community members and elders gather to resolve disputes and restore social harmony. Drawing on this tradition, Rwanda adopted Gacaca, a community justice-based system. These gatherings often took places under a tree, as you can see in the image, and a tree that also had significant meaning to our society. This became a place where people came together in one shared space to reflect on what had happened in order to begin a collective and relational approach that was grounded in lived experiences. Gacaca, or the Gacaca courts, later evolved into a nationwide community-based justice mechanism. Communities elected judges. As you can see, the ones who have the blue and yellow sachets are the judges, and the person standing in front of them at the time was a perpetrator, and the community surround them. These judges were not lawyers by profession. They were individuals who were considered individuals of integrity in the community. They were trained to preside over cases, and perpetrators were sentenced based on the severity of their crimes. Those who confessed would receive reduced sentences, often in form of community service, as you can see on the image on the left. The Gacaca court was not only about legal classification or punishment. Instead, it drew on indigenous practices of collective accountability to create space for truth-telling, reconciliation within the very communities where harm had occurred. It required individuals to not only account for their actions, but to do so in the presence of those they had harmed. This process was grounded in justice, relationships, lived experiences, and shared responsibility. It was also a time for Rwanda to gather documentation and evidence of what had happened. So the image you see below are of individuals who were engaged in community service as part of their sentence. So through these Gacaca courts, ordinary citizens played a direct role in truth-telling and accountability. These testimonies helped document what happened during the genocide, and the courts created a space for communities to confront the past in order to shape the future. In many cases, survivors and perpetrators sat in the same space, beginning a very difficult journey towards coexistence. Between 2001 and 2012, the Gacaca courts prosecuted nearly 2 million cases, operating at an estimated cost of 3.3 million. In parallel, we had the International Criminal Tribunal for Rwanda. The International Criminal Tribunal for Rwanda was established to prosecute high-level cases. Operating from November 8, 1994 to December 31, 2015, the International Criminal Tribunal indicted 93 individuals with an annual budget of approximately $270 million. Here we see two different expressions of justice. On the left, I'm trying to make sure I know which my left and right is. We see the International Criminal Tribunal for Rwanda, which was formal, structured, and oftentimes they probably sat under a very beautiful building. Whereas on the right, we see the Gacaca courts, which was held outdoors, sometimes under trees. These were spaces where ordinary citizens gathered, listened, and spoke. Justice here was not removed from the people, it was embedded within them. After the Gacaca courts concluded, the process of reconstruction began, drawing on homegrown indigenous knowledge systems to derive economic recovery and rebuild social cohesion in our post-genocide context. And this is where my journey begins. In 2015, I began working with youth and adults from both survivor and ex-perpetrator families. Over the past 10 years, I continued to witness how individuals who carried deep pain began their healing journey and reimagined their future as a community. These spaces were collective, as you can see in my interaction with these amazing women who are survivors of the genocide. And at the beginning, survivors and perpetrators sat separately. Over time, that eased, and they were able to sit side by side, walking alongside this community. I learned that healing is not linear, and it does not happen in isolation. It happens in relationships. After more than a decade of working alongside these communities, I came to realize the importance of ensuring that indigenous grassroots interventions are not implemented, but also reflected in policy spaces. And as a Rotary Peace Fellow, this journey has deepened my commitment to critically examine power structures by rethinking, reframing, and reclaiming the very foundations of peace. I wanted to bring this back home to the very society that has hosted us for the past 2 years. And what can we learn from these indigenous communities in North Carolina? So indigenous knowledge practices are very much alive right here in North Carolina. Their community-led decision-making is present across many tribes, such as the Eastern Band of Cherokee Indians, forgive my pronunciation, where community members gather in council spaces to discuss issues that affect their people. Decisions here are not made in isolation, they are made collectively. There's also a key aspect of relational accountability, which shows up in how communities remain accountable, not just to each other, but to the land and future generations. The Okanichi Band of Saponi Nation is actively building a tribal center and cultural village, preserving history while creating spaces for future generations. Culture, as a form of resilience, is also evident in the Lambi tribe of North Carolina, where cultural identity, storytelling, and education have sustained the community despite historical exclusion and lack of federal recognition. And local leadership is also very much present, which is reflected in organizations such as the Cumberland County Association of Indian People, which provides services grounded in the needs and voices of the community, supporting education, health, and economic development. And this deeply connects to what we saw, in Rwanda. Justice was not removed from the community, it was brought back to it. People gathered, spoke, listened, and rebuilt relationships. So you might be wondering, what can we do with this information we've learned today? Let's partner for peace building. Our core message at this conference is peace. And now as our theme reminds us, peace is built from the margins. Yes, it's still morning. So this morning, I'd like to call upon you to fund and expand Indigenous-led initiatives, because most communities are already doing this work. I know the Rotary Foundation is also heavily involved in working with Indigenous communities, so maybe we can continue this process. Learn in relationships, because as we step into spaces, we should show up where peace is already being practiced. We need to integrate Indigenous approaches into our work and center community voice, dialogue, and collective healing. We also need to co-create knowledge with communities by working with them, not on them. Rwanda has demonstrated this by embedding Indigenous homegrown solutions into our national framework. Our Article 11 of the Constitution, acknowledges culture as a foundation for addressing local challenges. And this is not just a recognition, it's an action we practice every day. And because we are each leaders in our own capacity, we need to shift our power and resources towards community-led solutions where peace is already taking root. If there's anything that Gachacha teaches us, is that peace is not built from the center outward. It's built from the margins inward, through relationships, accountability, and shared responsibility. Because people do not return to places, they return to relationships. As I conclude this presentation, we have a beautiful spring weather, so please connect with me and we can have a discussion under a tree. Thank you.
Break your leg, yeah. Just give me a second, sorry.
Can you hear me? Can you hear me? It's gonna keep falling. Can you hear me now? Thank you. Hi. Finally, I cannot believe that I'm here today speaking to all of you here and online. Coming from Gaza, I always felt voiceless, especially since October 2023. So thank you for giving me the opportunity to share my voice with all of you today. My name is Khaled, or Khaled, and I'm a Rotary Peace Fellow in the Global Studies program at UNC here. I'm here today to share a bit about my life in Gaza and what brought me here. I will also talk about a project I have been working on that could help thousands of Gazans and young people around the world, help them find peace and purpose. A few weeks ago, I woke up alone, exhausted, and in more physical pain than I have ever known. I just had come out of surgery for ACL and meniscus reconstruction, as you can see. This is the kind of surgery that your body reminds you so loudly that it has limits, and it puts you in so much pain. And lying there in my bed, in that stillness, I did something I had not allowed myself to do in so long. I had reflected. I thought about what I was there. I thought about who I was 3 years ago, before October 2023. I was athletic, energetic, and strong. I moved through the world with confidence in my body, in my future, in the path I was on. That morning, in pain, I felt old. I felt frail. I felt like I had lost versions of myself I might never get back. But here's what I did not lose: hope. Not because I manufactured it on my own, I could not have, but because people did not give up on me. Rotary did not give up on me. My friends, my family, people who showed up when I had nothing to offer them in return. They held the hope on my behalf until I was strong enough to hold it again myself. If hope can be kept alive for me under these circumstances, I can keep it alive for someone else. That is why I'm here today. Before October 2023, I had a career I was proud of. I managed scholarship and exchange programs. I helped young Palestinians access opportunities beyond their borders, universities, fellowships, and international experiences that expanded what they believed was possible for themselves. I watched up close what happens to a young person when someone truly invests in them, when a door opens that they never thought would open for them. I saw a future change. I saw people change. That work was the most meaningful thing I had ever done. We had normal lives with beautiful routines. Like, for example, this is a photo of my mom at the beach in Gaza. We would walk every weekend together on the beach, and when I said goodbye to her in November 2023, and I think she as well, we believed that we may never see each other again because of the circumstances. But I hope she and my family and friends can be proud of me right now. At least virtually, they can see me. This is my lovely niece, Alia. She was named after my mom. She also joined me in walks at the beach in Gaza. And finally, this is my son, Jad, who would rather enjoy the waves than walk on the beach. And finally, this time, another photo of the Gaza beach I took right after I went out on a date with someone. The photo is amazing. The date was not so good. There was a turning point, though, in October 2023, when everything around me collapsed. After October 2023, Gaza was in terrible shape, and things got worse over time. Unemployment reached about 78%. 1.3 million Palestinians out of the total of 2.1 in Gaza were displaced, living in 970 displacement camps located inside and outside of Gaza. Nearly every school, technical institute, and university building in Gaza was demolished or in significant need for repair. 100,000 Palestinians and Gazans are now living in Egypt with no legal status or work permit. This includes my family as well. It was a crisis, so I focused on what I knew best. I knew how to build programs. I knew how to identify young people with potential and connect them to opportunity. I knew that the right investment at the right moment in the right person could change the entire direction of a life. But the context had changed. The exchange programs were suspended. The local economy, already fragile, had shattered. But the young people are still there, and they still have their minds, their dreams, and their potential. So I asked myself, what skills could give them access to the global economy, regardless of where they are physically located? The answer was obvious. Transferable skills like coding, programming, and graphic design, and AI prompt engineering. However, could I design a program that could provide this? I know I could, but I have to pause here, because when you've watched things you built be destroyed, hope starts to feel like a risk you cannot afford. Starting something new in the middle of that environment felt terrifying, not because of the work it required, but because of what it would mean if it failed. What if I poured everything into this and it fell apart? I was not sure I had the strength to build something again. I think a lot of Gazans feel the same way. And lying in that hospital bed a few weeks ago, I felt it in my body too. The fear that what you're building might be destroyed. I am not going to stand here and pretend I simply overcame that fear. I have not. What I will say is this: I decided that doing nothing was its own kind of loss. And that was enough to motivate me to take the next step. So what is Coding for Peace in Gaza? What is my initiative? Well, it was an idea I developed in my Peace Lab project in my first semester here. It teaches young displaced Palestinians the technical skills to enter the global market, the global job market. It focuses on real employable skills like web development, programming fundamentals, graphic design, AI prompt engineering, which are the tools that companies around the world are actively hiring for right now. And alongside the technical training, it gives those young people something equally as important: the unshakable belief that this path is genuinely available to them. This is not charity. This is an investment. These people who, if given the right tools, will build things for the future that matter. So the program is 12 months in length and has 4 phases. It aims at giving 3 population groups the following components: mental health training for 1 month, and it's also going to be concurrent; English language training for 1 month; programming like Python or a different language, graphic design, online marketing, AI prompt engineering for 6 months; and finally, mentorship for 4 months to make sure every participant is mentored while they find jobs online on platforms such as Upwork or freelance.com. The pilot project would seek to enroll 3 groups. The first one is Gazan parents above the age of 30 who are in Egypt. They have no legal status, they cannot work, so this would give them that opportunity. University graduates in Gaza who are unemployed. And the third group, which is the long-term goal, is to give training to school students between grades 11 through 12, so they can graduate and pursue that kind of career for themselves. The pilot group I would like to start with is around 30 Gazans in Egypt. If that becomes successful, then we can carry on with the second group in Gaza. In my years running scholarship programs, I learned something I believe more deeply now than ever have. Hope is not something you feel on your own. It is something that gets transferred person to person, story to story, investment to investment, Rotarian to Rotarian. I saw it every time a young person received a scholarship they did not think they deserved. Every time someone came back from an exchange program with a different understanding of what was possible for their life. The hope was not in the program itself. It was in the message the program sent. You are worth investing in. Your future is worth building. That message, delivered at the right time, changes everything. Rotary sent me that message. And right now, an entire generation in Gaza is waiting for someone to send it to them. Here's what I need from you today to help make a change. You can fund a student. A small monthly contribution covers the cost of training for a young person who has no other path right now. You can offer your expertise. If you work in tech, in education, in recruitment, an hour of mentorship, a mock interview, a code review, these things have an outsized impact on someone who has never had access to professional networks. You can also hire someone. If your company hires remotely, consider our graduates. They are motivated in a way that is genuinely hard to find. Finally, share this story, not just today, tomorrow or next week. The more people who hear about it, the more bridges get built. And for more information, you can scan the QR code and join me for a conversation at lunch after the panel discussion. In conclusion, I just want to share something. This was me 20 years ago, almost, yeah, 20 years ago. I live in a constant cycle of hopelessness. I really do. But I keep being reminded by all of you that collectively, we can make a difference. War can destroy potential, but it cannot destroy human potential. Let's say that again. War can destroy buildings, but it cannot destroy human potential. And maybe one human investment at a time, we can help rebuild the future. Let's all together imagine a better future for these kids. Let's all truly and really embrace the Rotary motto, service above self. Thank you. Up one on. Yeah, I'll keep it on. What's that? Can you just stay breeze keeping with you? Just keep this. Solve them. You do this. You decide that. Thank you. Oh, no, I'll be fine. I'll be fine. No, I'll be fine. Thank you. Let me just hold this for a second.
As we settle in, I'll briefly start. My name is Erica Johnson. I teach here at UNC in Global Studies, and I'm director of the graduate program in Global Studies, in which several of these students are studying. I'm delighted to be part of the panel. I thank you all for these amazing presentations, and please one more time congratulate them on their accomplishment. I'll also echo Suzanne's thank yous to the Rotarians present, to Rotary International, for obviously the investment in these students. It's clear what that payoff is for their individual lives, but this really is a program that enriches our campuses across UNC and Duke tremendously. Our graduates throughout Global Studies get to be learn beside the faculty, these amazing people, the faculty as well. So this is really a community empowering experience. On the theme of the panel, community empowering, I'm going to start with the moderator's privilege to ask the first question, but I'll also ask if you have a question out there, please put up your hands so the microphones are at the ready when we get through this first round. So community empowerment is the theme of the panel, and you each in different ways have shown examples of what that might look like through creativity, through organizing, through indigenous knowledge, through skill building. I wonder, in your experience as fellows, in your experience in your master's programs, or just in your experiences in this United States culture, what is a memory or your own lived experience of community empowerment that you'd take away? Here, I'll give you this. I won't need to say anything. Okay.
Thank you, Erica. I'm actually, to respond to your question, I'm actually going to borrow something from Rory's presentation about food. So being a social worker means I'm also privileged to have both, engage in both theoretical experience, but also practical experience through the different practicums that we do during our 2 years here. So I have been doing my practicum at Refugee Community Partnership, which is based in Cabro. And one of the ways, because Refugee Community Partnerships works with so many different communities from different cultures, different contexts. And one of the things that I've seen that brings people together is food. Just like Rory said, you know, people will either enjoy the food. For us, most part, we enjoy the food. And that becomes like a good basis for conversation, which is also very similar in my community. Anytime someone comes to your home, the first thing you'll do is give them food. So food has become a big part of some of the ways where I believe communities can continue to engage, but also has been a big part of my journey as a social worker as well. Yeah.
I would have loved to have said food, but Debbie took it. So to think of something. No, actually, it's an easy one. When you asked the question, Erica, the first thing that came to mind was Rotary. I think we've all enjoyed, but also learned a lot from the way that you all gather and the way that you have your rituals. You meet once a week, you try and show up every week. Yeah, you're there with whatever you're going through in life, you show up for each other. And I think that's amazing for us as Peace Fellows, because we've sort of copied some of that in the way that we do things. And we've been to your meetings, we've really enjoyed them, but taken from that the best thing about it, which is you all coming together across wide ranges of difference. I had the pleasure of going to a meeting over in Colorado, and it was just so nice to walk in the room knowing that it'll be such a welcoming, safe space to go to, and that meant a lot.
Thanks. Alongside Rotary and food. For me, my MIDP program itself, I felt very much in a community. The way how institutions work, they really put human at the center. So I really felt that, you know, all the education system and how the institutions operate, they put humans at the center. They really care for it. I can see my professor here, Natalia, and I can see some of the admin. Christine is there, like some of the people who really value and check on the people. So that's something that I really admire. Whenever I have a problem or like crisis, I go to admin, for example, and share. So those kind of human connection was something that maybe I was not able to put trust on in maybe back home. So something built on trust. This community is, I feel like, very much flourishing, not only for me, but for all the international students at Duke. I can talk about Duke for now.
Good answer, yeah. Well, for me, I mean, I think I shared that the aspect of voicelessness. And I feel like here my voice was heard. And I feel like I was able to feel safe in classrooms. And this, I want to say this to say thank you to Erica, Angela, and so many other professors. Like, they heard our voices and they made sure that we have a safe space to feel we're in a community. And that was empowerment for me. Like, my voice was being heard and respected in a lot of ways. So that was really a moment. I learned so much from being here. Rotary as well. Like, honestly, everyone here at Rotary also made, like, I presented them with so many challenges, and they know, and there was, every time Jean and Susan were like, well, you're fine, we'll figure it out. And we did. So that also, the sense of community was a way to feel empowered. Yeah.
So what do we have as yes? What do you all want to know from these amazing people? Oh, great.
So I'm Laura Desher. I'm the program director for the Peace Centers. And something I'm always struck by is how achievable a lot of these solutions sound. And Debbie, you put the dollar figure to it, that doing these community-based solutions are often much more cost-effective, sustainable, impactful than maybe some larger institutional reforms. So for all of you, what is that gap that's missing between why we continue to fund large-scale interventions over kind of smaller community solutions, and what message would you hope would get across as to why these interventions are so important and useful?
Big question. Yeah. I'll start. Yeah. Because I think you're going to have better answers. So yeah. I think the way we look at projects and programs, initiatives, we build from the top up, from the top down. I think if we really consider like the bottom up approach, then that will have more like impactful projects and initiatives. I would never have thought possible that this generation in Gaza, for example, would need that initiative to kind of help them. Just because I'm from there, I know that I can fill that gap. So I think we just need to listen to the voices in those communities and really, really listen to them so we can fix the problems that they have.
To listen to the voices of the community, we need trust. We need to build trust, right? So it seems like the development that we have been doing since the end of World War, it's based on the expats' knowledge, which is definitely like useful in so many contexts, but might not in many contexts of the grassroots in the where marginalized people are the developing countries, right? So having this trust to the communities is really like giving them the power to decide for themselves, bringing them in this co-creation journey of projects. So that, I think that's very important to develop, co-design the projects together with experts and the community, which I think we are walking towards that path right now, but there is a long way to go to. It takes a lot of courage and empathy to give the mic to the voiceless, because like we have been a voice of a voiceless for many years, but we have never tried to give a mic, pass the mic, just sort up and give the mic.
Take the mic. Thank you.
Take it.
I love the question of funding. I think that's a part of my research I've been doing with Erica. I think in every job and world I've been in, pilot funding has been some of the most useful funding out there. It's the one that has the lowest expectation, but sometimes the highest. It's amount of trust that you give to somebody to implement their ideas and see how that goes and build on it later on. I think Rotary does that quite well, and I think there's always room for improvement with every funding organization. We, at the State Department, we would send people on exchanges for 3 weeks, emerging leaders, professional leaders from across civil service and NGOs and business. And some of the most impactful projects we saw were the ones that we only spent maybe $5,000. And we'd give a civil servant who was doing something in their free time the chance to convene people on climate change and bring people together on questions that maybe government institutions weren't working on. And that kept rolling and kept working. And it was this sort of trust that we gave one person with a small amount of money to try it out, see if it works, and learn from it and build.
I totally agree with everything they've all said, but I'm also going to talk about something that I was also trying to work on when I was back home. When you look at a lot of the indigenous knowledge practices, most of these are rarely passed on to the next generation, because some of these practices are very oral in terms of traditions. And so this is where now our our role comes in, because we have not been documenting some of these practices. And so that means, even to Rory's point, like when funding comes, it means because we don't have anything documented, it's very rare for us to compete for these types of funding. And because it comes with a lot of restrictions, you have to reach this population, you have to do this, you have to, all the restrictions that come with different types of funding. So then I guess it also comes back to now, when it comes to thinking of co-creating with these indigenous populations, how do you co-create with them? So then now that funding can also be used to co-create some of these initiatives so that they're documented and people know about them. And then it becomes like a global movement where people are able to understand how they work.
We do have an online audience, and I know Christian is collecting questions. Do you have a couple, one or two, to throw to the group here?
I do. Can you hear me? Yes. So we have questions from the audience, one specifically for Nish. How do you ensure that artivism doesn't become performative, only creating emotional impact without leading to real structural change?
That's a really good question. So that's why I think artivism, to not make it performative, we have to understand the two components of it. Artivism is not only about art. So most of the time when we talk about artivism, it feels like we're doing some kind of artwork, trying to push the masses, political masses through art. But actually it is also about strategy, the second component or the first component. So strategy is really about coming together, designing the solution together, understanding what kind of assets we have in the community, what kind of resources we can build upon. So that process of co-creation, or like that process of planning, will make it more impactful. It will rather not be a performative. It will become more impactful action.
Yes. So we have an next. Go ahead.
Again? Thank you. You saved my life. Hello, this is Andres, also from the MIDP program. Thank you, guys. It was amazing to listen to you. I have a question regarding structures and systems. So Rotary, companies, universities, all of them are organizations which tend to be very structured or hierarchical, and they tend to work on silos. Oh, I do this project for my club, for my district, for my university, and we are the ones doing this, right? But how can you invite us, or what can we do to break those silos and collaborate more with maybe with you, or maybe with other organizations? Thank you.
Take it away.
Yeah. So first of all, thank you so much, Andres, for the question. I think I personally believe that the institutions that we are trying to develop, the center, for example, is a path to break that silos. Rotary is working with Duke University and UNC University to break that silos, right? So I feel like we are on that path. It's like this kind of a co-creation, collaboration journey that we are trying to build is a pathway towards breaking the silos. Yeah.
Again. I'll take it. Yeah, I like the question. I spent 5 years in a huge bureaucracy that never ended, and I really enjoyed it. I think one of the reasons is that people are generally very surprised when inside bureaucracies there are humans that you can interact with, and in that you can shape a lot, you can influence a lot, you can build relationships that shape outcomes and what's possible. So I think we maybe have a tendency to see institutions and structures as impermeable and never changing, which feels true quite often. Like it definitely seems like that when you want some sort of change that's not been delivered yet. But I think tapping into the humans that are in those structures, probably the majority of them want some kind of change too. It's like working with that is what I really enjoy. The book that I recommended, The Art of Gathering, gets to that question of how to do that in community groups, but also how to do that in institutions that rarely work together or learn from the individuals on the ground. So it's worth reading on that point.
The other thing I would like to say is it's important to be intentional. And I guess this is where all our roles come in as Rotary Peace Fellows. I mean, if you read through the booklet, you'll see that each of us come from very diverse professional careers, fields. And so if, for instance, I find myself in a position where I'm leading an organization and I want to work with different communities, my first instinct will be, let me think about who are the stakeholders that need to be involved in this project. So obviously I'll think about Rotary. I mean, being a Rotary Peace Fellow, that's kind of automatic. Think about everybody else who would be able to contribute towards this project. So I think sometimes there's that, the willingness is there, but the lack of being intentional with that approach is what lacks. And so the moment we become intentional, then all of these stakeholders come together and you realize that you can reach more people by working together rather than working in isolation. Yeah.
Well, I don't have much to add, honestly. You said it very well, guys. But I think just intentional and reach out as a peace worker. I feel like in my work, we had sometimes so little budget to do a project and we just reach out to some sponsors. We're like, yeah, we will fund lunch, we will cover transportation, we'll do this and that. So I think the intentional reaching out to other stakeholders, you'd be surprised, bless you. You'd be surprised how many people would open their arms for you to help you bring peace or bring a project or a change somewhere.
We have that, yep.
Okay, and not a question, but a reflection on the last presentation, which was very impactful. Thank you for that. A favorite poet of mine is Seamus Heaney, an Irish poet who wrote quite a bit about hope as well. And he wrote about Northern Ireland and the troubles leading up to the 1998 Easter Accords. In his poem, The Cure at Troy, this is what he said: "Once in a lifetime, the longed-for tidal wave of justice can rise up, and hope and history rhyme. And hope and history rhyme." I hope hope and history rhymes for you soon, my friend.
Thank you. Yeah, me too.
We have another online question. There's a man with a blue tie here who would like, do we have another online question?
Okay. Okay. Yes. I apologize.
Go ahead.
Okay, I'm so sorry, causing so much confusion. First, Khalid, I guess I speak for everyone here. I hope your family is safe. I truly do. A tragedy, but I do hope they're safe. My question to the panel is, you talked about activism, the Gaza tree, the different arts. However, most organized activisms has some sort of outreach, whether it be Sinn Féin, the ANC, FARC, they had to create lasting peace. And in every one of those, there was a component of reconciliation, forgiveness. Sometimes that's extremely hard because it's an emotional concept. But ask you, how is that working, especially in Nepal and in Rwanda, that act of forgiving those atrocities, and is it working?
So it has already been 20 years of ending of civil war in Nepal, and we still feel like no, there hasn't been this TRC hasn't worked properly, because those who were doing that atrocities are still in power, both from the Maoist side and from the military side. So yeah, that's something that I am working, and my team is working, is through building this collective power. A lot of marginalized people who were brought to protest, for a violent protest, as who were recruited as soldiers. We are trying to work with their younger ones to to teach them the peaceful way to resist, still resist, and do some collective action so that their voices are heard. They can put their voice in the table. So yeah, it's also a very challenging thing to do. Of course, institutions are not strong, and that's what I was telling earlier. The institution here is very strong, and that's why I think one of my goal is to also learn about how policy works, how institutions work, and maybe contribute back to building strong institutions in Nepal, which in return will create more justful society and bring justice to those who suffered from atrocities.
So I'll probably start with your last question where you asked whether it works. So in my context, yes, but also it has taken over 32 years for us to get to where we are at today. When I think about some of the strategies, at least as someone who worked directly with my own community, one is to be mindful of the context and the types of approaches that you use to bring people together to be able to begin this very difficult journey. So in Rwanda, one of the things I say is that we're very privileged because we speak the same local language. So that made it very easy for us to be relatable with the community. Unlike in some communities where there are different dialects, for us, we speak the same dialect or the same language. So this is made it very easier for us to bring people together. But also there had to be the willingness from the community themselves because you cannot impose some of these practices. And so our role was to show the communities how this can be impactful, at the same time allowing them to voice their concerns, because obviously it's not easy to bring together two very different individuals who have very different traumas, who are affected by the genocide against the Tutsi in so many different ways. And so it was a journey of continuous trial and error, sometimes trying things that were very unconventional, because one of the criticisms we get a lot was that our traditional justice mechanism was very unconventional. We didn't have judges who are like legal lawyers and things like that. But then at the same time, it was also very impactful for our community, for them to see people they could relate with and not someone who's come from a different context altogether. And so those are some of the strategies that I believe have really been very impactful. But also the other thing I must say is patience. When it comes to healing work and working with the communities, you cannot expect results overnight. It takes 2, 3 years, 5, 10 years, and the journey is still going on. We still have a lot of community members who are still undergoing trauma as a result of what happened to our country. So you have to be patient. Even as someone working with these communities, patience is crucial.
Christian, I'll try again for the online question.
Okay, so question for Debbie. What gaps or challenges became evident after the Gacaca courts concluded their work?
Thank you. The biggest challenges we faced after the Gacaca courts was trauma. Because a lot of this happened within a span of 10 years. And so the biggest challenge now we had to deal with was trauma. And so this is where the government, but also civil society organizations, practitioners, everybody decided to chip in. So for the longest time after the genocide against the Tutsi, a lot of, I say this with the generation of my parents, most of them had to give their I would say their service in form of like a voluntary role, because as you know, infrastructure was destroyed. And so a lot had to be done to begin that reconciliation process. So trauma, but also when it came to, there was also a challenge with some of the perpetrators who were also, some individuals were wrongly accused. And so this is why documentation was also a very important part of the process. And so through that documentation, people were able to find out what exactly happened in what area, and so that everybody who was held accountable actually committed genocide crimes and not just holding people based on hearsay. The other thing I would say was a challenge for us, obviously, was infrastructure. and resources, because a lot of the times these courts were held under places where obviously things like basic needs were also hard to get by because the government didn't have any. I know there was a lot of, that was the time actually where we started receiving funding to be able to fund the Gacaca courts. So yeah, there's a lot to say, but I'll leave it at that. Yeah.
Then in the middle here we have, yeah, go ahead.
Hi, thank you. Way back when you were mentioning the oral handing down of traditions, it made me think about technology and how much has changed in the last 15, 20, 25 years with the internet, but especially smartphones and the proliferation even in rural communities and developing countries, and the change in the cultures and youth who weren't, especially in Rwanda, they weren't a part of the genocide. They were born afterwards. And as incorporating indigenous traditions into political decisions and everything, I wondered if you could just address how technology is impacting the changes in in traditions, indigenous traditions, please.
Yeah, that's actually a very good question, because Rwanda has become one of the places, I would say, in East Africa where internet connectivity is really high on the rise. We have so many spaces where internet is available. And so this has been one of the strategies we've been trying to do as part of rebuilding our country, to ensure that we use technology to the better advancement of what we want to achieve as a community. And so if you look at, as I mentioned in my presentation earlier, this being the 32nd commemoration of the 1994 genocide against the Tutsi, you'll see a lot of the media, there is those aspects of documentation. So because of that, we've been able to use technology to our advantage to not only bring these stories to light, but also to document some of the traditions that were really very impactful for our community. So because time would not allow, but there's one thing that we have been using that has been very indigenous in terms of like dealing with the issues our country has been facing, and we call them homegrown solutions. So these are documented strategies that we've been using, and these can be found online. So like I said, you can connect with me under a tree and I can talk more about them. But these have been really, we've been documenting this also along the lines of not only for our community, but for other people to be able to learn from these practices. Because I believe you can't take everything that you've seen in a particular context and implement it in another. But there are certain things that you can definitely borrow. So this is what we've been doing when it comes to, we have 70% of our population are young people. We are a very young country. And so because of that, that means we are leveraging a lot on the experiences of young people to be able to document these practices, but also with the challenge of having lost a huge elderly population, we're still trying to figure out how is the best way to make sure that whatever memories and tools that they left our community with are kept alive for future generations.
Okay, we are ready for a lunch break. So first, let's congratulate these fellows one more time. Yeah, you're getting a standing ovation. And then we do invite you to continue the conversation at lunch through on the first floor and the second floor. Enjoy. What time do we start again? 1:30.
I know, you're like, sorry, you have no, it's actually wrong camera. It's inappropriate. You have a committee. That battery is fine. That is fine.
Oh, it's full. This is battery का sign, ना?
Like what was happening actually? ये वाला.
So much. I just wanted to start with the official. So you breathe out. Yeah, you breathe out. Always an easy job with these.
But yeah.
This is also on.
तो ये batteries, you know, you would have just turn it off. Hold on, and then powering off. Yeah, it doesn't do it. Oh, what are you lying?
Testing, testing, 1, 2, 3, testing.
This is testing microphone.
Fine.
That's fine.
Oh, probably the system is off. Off? No, it's on. Good morning, everyone. Good? Yeah. Okay.
This is nice as you can put your legs up.
All right, if everyone could take their seats, we'll get started. Thanks. All right, we're going to get started. Okay, thank you very much. We're going to get started here. I hope you have found inspiration, new ideas, insights, and been moved by the presentations you've had this morning. I promise you that continues in this next and final panel. The theme is healing the injured, and you're going to hear inspirational stories here too. So we're going to start with Charmaine.
Hello, everyone. Someone had to do a presentation after lunch. So I hope the second cup of coffee is doing its job. And you can stay with me with full attention for the next 12 minutes because what I want to say is very important. Hi, my name is Sharmeen Hakim. I'm a journalist, an author, a partial lawyer, law graduate, and a peace fellow from Mumbai in India. That's my safe place. That's a picture of me and my mother. And by the time I'm done with this presentation, you'll know why I started here. Today, I want to talk about peace and how it's built in the most violent place in the world, the carceral system or in prisons. More specifically, I want to talk about the most overlooked population on the discourse on prisons, the families. Someone once asked me, why do you study incarceration? It's so negative and nobody wants to hear about it. And it took me back to the first day I entered a courtroom. I braced for monsters, but I didn't see them. I saw mothers, I saw partners, and I saw children being disciplined on court rules. And that's when I realized that families are collateral damage in this discourse on incarceration, or that law relegates so deep into the margins that they almost become invisible. After I arrived in the United States, I continued my researching on and with families of incarcerated people, but with renewed theoretical vigor. And that's when I met Rotarian Mr. Richard McCleary from the Durham Rotary Club. And he encouraged me to explore the same subject that I was studying in India here in the United States. And I'm very grateful to him because that one conversation opened a door. I found myself interviewing formerly incarcerated people in the Scarborough soup kitchen. I found myself another day in the Hillsborough Penitentiary in circle with other people who had caused harm. But most importantly, over the last year, I found myself with the women, the backbone of this system, and I interviewed several of them. So today I want to tell you about Shaina. Shaina was born in Flint, Michigan, in a neighborhood so violent, it engulfs one's ability to dream. She was raised by a single mother, alongside 3 siblings, and an absentee father. Shaina was just 3 years old when she watched the weight of the world break her mother's back. Her mother worked at Walmart, and the heavy lifting left her mother disabled. She and her siblings were then being brought up and raised on just $800 a month. The desperation of poverty pulled both her brothers into the system. Her sister moved away too. But Shaina's mother was always in her face. There were no late night parties. There was no sleepovers, and that paid off because Shaina graduated and then she became a college counselor. Shaina met her husband and she knew about his prior convictions, but they were in his youth and they were drug related. And her mother approved of him, so she approved of him. Because she watched him show up differently than her father did. He was there for her daughter every single day, a child that wasn't even his own. But he couldn't find employment because of his prior convictions and record. And then came the arrest. He was found in possession of a firearm and he got 5 years in prison. Shaina's life changed overnight. Her responsibilities doubled. She now homeschools her 10-year-old to protect her from the stigma of having a dad in prison. She puts money on her husband's phone and waits for a 15-minute call. She tries to pack in everything in those 15 minutes. She pays to say, I love you. She pays to say, I miss you. As communications in prison is a huge corporate lobby. She absorbs half the lost income. She buys commissary items because the prison doesn't provide warm shoes in the winter. Toiletries the state can easily afford. She pays for food because what's provided is inedible. She pays for mortgage. She checks on his parents who did manual labor their entire life. And then Shaina drives 6 hours, leaving her children behind, books a hotel, plans meals, everything only to meet her husband in visitation. Shaina hates visitation. It's humiliating and it's dehumanizing. She can be turned away for wearing something deemed too flashy. Then come the pat downs, the underwire bra removal, the lift your hair, turn around, all to sit in front of the man she married for just 2 hours. The average annual cost to maintain communications with someone in prison is $4,200. And then I asked her, so Shaina, what would you change about this system? And I quote, what I would change about the system is how they treat loved ones, people who come in with empathy and compassion. Even if someone made a mistake, they're still people and people deserve second chances. Everyone deserves to be loved. We shouldn't be treated like nothing because we love someone they think is nothing. We are in prison too. We are incarcerated too. I probed her further. I said, but there must be something. She said, I know my presence makes a difference. I bring him peace and I see growth every day. And that's why I show up. Shaina sees what the rest of us don't. She sees growth. And that's when I realized that families are not collateral damage. They are peace builders working from the margins, and their well-being should be at the core of any policy on incarceration. Shaina is not alone. Alice sold her bed and other household items to raise her husband's biological daughter from his previous relationship because he was showing up differently. And then there was Kira, who did trauma healing workbooks with her husband in prison. And both of them started an NGO while her husband was still incarcerated. He still is. She from the outside and he from the inside. They divert young people away from the system because her husband doesn't want another child to have the faith that he did. But Kira's visitation rights were revoked the moment she started exposing prison conditions. My research shows these women advocate when the state neglects. They show up when no services exist. They are not peripheral to the questions of peace and justice. They are the unrecognized infrastructure of repair. Some countries honor their dignity and understand the cyclical process of violence. In Saudi Arabia, programs provide rent, utilities, food, and scholarships for children of incarcerated breadwinners. Their imprisonment and reoffending rates are significantly lower. Norway uses the principle of normality. Re-entry planning begins from day one. So prisons are designed to resemble the home. They have child-friendly officers, family visits. Their recidivism and reoffending rates are just 20%. The US stands at 67%. We would hope to bring these reforms right here where we are, but the scale of incarceration makes it complicated. The United States incarcerates more people than any country in the world. Despite just 4% of the world's population, 20% of the world's prisoners are in prison here. But that's not the scale of the problem. 113 million Americans have had an immediate family member imprisoned. That's 1 in 3 people. Incarceration is not an individual experience, it's a family experience. The economic cost of mass incarceration on families with a loved one behind bars is approximately $348 billion annually in the United States. Let that number sink in. But what's the breakup of the $348 billion? There's loss of income for formerly incarcerated people, like Shaina's husband who couldn't find employment. There's loss of income for children who are affected the most. There's a generational tax that these children have to pay because of the trauma, educational disruption, and unstable upbringings. They are most likely to support a parent behind bars. And then there's the hidden tax, the type that Shaina pays every single day for the phone calls, the visitations, just to keep their loved ones warm, fed, and human. So I ask, who benefits from this current system? Not the victims, who often feel like they're not heard in the process, in the legal process. Not taxpayers, who fund to stop a cycle of violence that just doesn't seem to break. Not families like Shaina's, whose economic futures and children's lives are diminished by the system. Not incarcerated people who return home more traumatized than they went in. And therefore, I propose a family-centered approach to imprisonment. I propose that we learn about the impact of imprisonment on families in the United States. We invite a speaker to the Rotary Club. We remove the stigma of incarceration. We engage facilitators for a dialogue. And then the Prison Policy Initiative has proposed concrete and bite-sized reform bills you can support in your state. You can access this information by scanning the QR code, because in the United States, 80% of the bills don't fail because of lack of evidence, they fail because of lack of belief. That can change today. The third component of this family-centered approach is a different approach to violence itself. Many here must be familiar with the concept of restorative justice. A few of the attorneys who I interviewed and who represent people on death row are pursuing this form of justice. They ask the person who was harmed, what are your needs? And then they ask the person who caused the harm if they would take accountability. The two come together in circle along with mediators, communities, and their families to come up with a repair agreement to the satisfaction of the victim. This is happening right here in Durham. Now I want to bring you back to the photograph of my mother. In my childhood journal, my mother wrote, "Whatever mistakes you make, whatever you become, we will always have a place in our hearts, our lives, and home for you. Our family has been built on a rock-solid foundation of love." I understand her words differently now. How similar these words are to Shaina's. That unconditional belonging is what keeps communities safe. Love, not only punishment. What if we welcome people who've served their time with kindness and compassion? That's what makes peace possible. Thank you so much.
It's working? Okay. Fellow Rotarians, distinguished guests, fellow peace builders, and everyone joining us live or on YouTube, thank you. My name is Hafiz. I am a physician from Ethiopia, the land that brought the world coffee, which I hope is kicking in right about now. I am also a Class 23 Rotary Peace Fellow, and I'm completing my MPH at UNC Gillings. But today, I'm not here as any of those things. I am someone who has stood exactly where the people in this talk stand. This conference is about building peace from the margins. Let me show you what the margins look like up close. Picture a frontline health worker in a conflict-scarred region of Africa, on call after 36 straight hours. That morning, they save a 3-year-old boy who mistook rat poison for candy. They tracked down a patient who fled confinement for multi-drug resistant tuberculosis. Then things take a turn, as they usually do. The health worker sits with the parents of triplets and tells them that they have lost their second child in 4 days to an infection because the right antibiotics did not exist. But the day does not end there. That same health worker sees 60 patients when the guideline caps the day at 40. Hospital administrators press them to cover up a cholera outbreak. Gunshot wounds from a land dispute fill the corridors. And then a phone rings. A family member hundreds of miles away has attempted suicide. At first light, the meadow blazes green and gold, and this health worker stands on their last legs, caught in a paradox. They spent most of their life healing others. But who heals the healer? That question is not abstract, it's existential. For every peace builder and for the peace we are all here to build. Before I show you any evidence, I want to tell you why this matters. Peace builders are human beings who deserve care as a matter of dignity. That is the moral case. But there is also a practical case. When we provide that care, especially through the relationships closest to them, we protect not only the humanity, but also the quality, steadiness, and sustainability of the work we depend on them to do. Those two truths are not in tension. They reinforce each other. So this is both the right thing to do and the smart thing to do. The peace-building world is losing its people, not to conflict, but to the work of peace itself. Recent humanitarian evidence shows high levels of burnout, depression, anxiety, and post-traumatic stress across this workforce. Burnout ranges roughly from about 1 in 12 to nearly 1 in 3, depending on the study and setting. In one high-risk sample from South Sudan, 39% screened positive for depression. And in that same setting, 24% screened positive for PTSD. So when I say that there is a hidden crisis, I do not mean a symbolic one. I mean a measurable crisis affecting real workers and real systems under real strain. These are not abstractions. They are colleagues, project partners, and some of us in this room. But here is what those statistics miss. For some peace builders, not all, the story does not begin on the front line. It begins in childhood. Research shows that many health and social care workers face adverse childhood experiences, or better known as ACEs, with over 70% reporting at least one. Childhood adversity and parentification can impact their choice to pursue caregiving roles and their performance at work. While not all peace builders share this background, it's an important factor for understanding their strengths and vulnerabilities. Gabor Mate, a physician and trauma expert, highlights the tension between attachment and authenticity. Attachment involves maintaining connections with caregivers, while authenticity focuses on recognizing one's own feelings and needs. When these two drives conflict, children often prioritize attachment, which can lead to valuable traits like empathy and responsibility. However, as adults, these adaptations can become liabilities, causing individuals to handle others' distress while neglecting their own limits. Recognizing this pattern is a step one can take toward breaking the cycle. So, what actually protects them? Organizations often invest in individual level solutions, such as counseling, resilience workshops, and rest. While these measures are important and beneficial for many, they don't address the broader issues at play. Several studies suggest that close relational support matters for people working under chronic stress. On the Thai-Myanmar border, family support was associated with lower burnout among humanitarian aid workers. In Bangladesh, humanitarian worker burnout was linked not only to workplace stressors, but also to family-related strain, separation, and isolation. In the US, family readiness research in military population suggests that supporting spouses and close partners can strengthen overall resilience in high-stress service systems. So the family, or whoever constitutes a person's closest relational system, is not peripheral to resilience. It may be one of the structures that helps sustain it. I call it the first circle of peace. The family is often the first architecture of resilience. And by family, I mean those you come home to, by blood or choice, including spouses, friends, and mentors who see your true self. For many, family hasn't always meant safety, as some grew up in homes needing peace building. The relational system around the peace builder influences whether resilience thrives or falters. Before we build peace across borders, we must build it in the place where every human being first learns what peace feels like or doesn't. The circle works in both directions. What the family carries, the peace builder carries to the field, and what the field does to them, they carry home. So, what follows from all of this? I want to offer 3 practical actions. First, a family readiness package that prepares not only the worker, but also their support system before deployment or intense assignments. This includes orientation for spouses or trusted supporters on emotional effects, warning signs, maintaining connection, and seeking help if needed. It's essential to prepare both the mission and the relationships that support worker success. Second, healer circles that offer structured, trauma-informed support spaces where peace builders can share their burdens. These can be peer-only or include trusted supporters, creating an intentional support network around the worker. Third, pilot relational models which involved testing interventions that view the peace builder as part of their relationships, not an isolated individual. This could include family-inclusive psychoeducation, supporter-informed check-ins, or community-based models. They can start as small, measurable pilots, focusing on burnout, retention, distress, and perceived support. These are concrete, promising, fundable, and testable interventions. Before I close, I owe you a confession. That health worker looking out at the blazing green and gold meadow on his last legs, that was me. I wasn't every scenario I described, but I know what it means to keep helping while privately unraveling. I know what it means to serve others before you have learned how to receive care yourself. I don't want to make this talk about me. I share it because if I don't, this remains an abstraction, and it's not abstract. What began to change things was not a single moment. It was a slow, clumsy process of letting people in. And I want to name something. A remarkable number of those people entered my life through Rotary. Not through a program, but through a community. Professors who invested in me, friends who called me on my nonsense, mentors who showed me what a first circle looks like by becoming one. I'm still learning. I suspect I will always be. Somewhere right now, it's first light. If we want peace building to be sustainable, then we have to protect the people who make peace possible. Not after they break, while they are still standing. Thank you.
Check.
Okay.
Good afternoon, everyone. Before I start, I just want to tell you what peace means to me. Peace for me is living without the fear of violence and having the agency and autonomy to make decisions and choices about my life. I am Priskila Arul Pragasam, a student at the UNC School of Social Work, a social worker and advocate for reproductive justice and gender equity from Sri Lanka. Today, I want to share with you about the healing and community I found in fabric and art. Fabric is an everyday item, interconnected and intertwined in our lives. It can be a powerful expression of identity and used not only to define oneself, but also to resist, challenge norms, and spark change in the community. My very first memories of fabric was seeing my mother and grandmother wear beautiful saris, and also seeing them work with fabric in the sewing machine and doing different kinds of sewing. And as a child, I was told to learn sewing because it would be a very useful skill for a girl. And just this association of it with a gender role just made me hate or dislike sewing. I was like, I am not sewing. You tell me something to do. You ask me to do something because I'm a girl, I'm never doing it. And that was me as a child. But as I grew, I worked with communities in Sri Lanka and saw how sewing skills empowered women from urban slum communities who are facing domestic violence. It was also something that created livelihoods for rural women who are working in garment factories. And I also started seeing sewing and fabric as a form of art and expression. And coming to UNC, I got to get something important. So coming to UNC, I decided to lean into fabric and sewing for a class assignment. The assignment required us to reflect on what oppression and resistance meant to us and what our experience about it was. So I created this rag doll to symbolize how often in this world a woman's body is wrapped in violence and systemic oppression. And this was mainly based on my own personal experiences and the experiences of women I worked with in my country and in my region. And when I was thinking of what I should work on for this Rotary Peace Conference presentation, I wanted to expand on this idea of fabric and violence against women. Because fabric holds so much more than what meets the eyes. The story I tell you today is a story of resilience, healing, and hope. After coming to North Carolina, I learned about an organization called Kiran that works with survivors of domestic violence from South Asian communities. Mostly immigrant men and women who came into these countries with hopes and dreams for a better future. I started volunteering with Kiran, and for the project, I approached Kiran and asked if I could work with them on this project. And they happily agreed. But as a student, I knew I couldn't do this on my own. I needed more support and guidance. And that's when I walked into Laurie's office. Laurie Campbell is a professor at the School of Social Work who uses art-based healing approaches. And she was very willing and happy to collaborate with me to organize an art workshop that centered healing and storytelling using fabric. Here's the fabric that we created together in this workshop with 10 women and 7 children who have experienced domestic violence. This piece carries stories of hope, stories of dreams, and resilience and healing. We started our workshop with the participants by asking them to reflect on their memory of fabric. And at this point, I want to call you to think a little bit about what your favorite piece of fabric is and what kind of memories does it hold for you. One of the respondents said that her memories of fabric was how her clothes were torn and ripped off her body in her marriage. She says that one day she dreams of collecting all these pieces of torn clothes and putting them together to make it something more beautiful. set the foundation for our discussion because fabric is powerful. You can rip it into 100 pieces, but you can still pick up those pieces and create something even more beautiful. You can stitch it together, you can paste it together and create something more beautiful. With this, we directed our conversation around healing, and we invited participants to pick from the wide range of fabric and materials that we made available to them and asked them to create a pattern or image that represented or that they saw as healing, what they envisioned healing to look like. And here are some of the stories that were shared with us. Taking a stand against an abuser and stepping out of that situation in a foreign land comes with many, many battles. One is the battle for survival, the battle for custody of children, the battle with divorce, and also the battle with immigration if you are dependent on your spouse. One of the participants stated that, me and my daughter, we are together amidst whatever life throws at us. And she is fighting the battle of custody for her daughter. People often come into this country with big hopes and big dreams. And incidents like domestic violence shatter these dreams. I want to be like a princess again and have a beautiful and colorful life, is what one of the participants said. The idea of family is a home with a father, a mother, and children. This is what the world calls as ideal. But I wasn't happy in this place. I had to break away from that. And today, I am happy here with my children. I may not have what the world calls an ideal family, but this is a happy place for me. And this mother created this drawing with her children, with her 2 daughters. Often, we are unable to make decisions or choices about our life and our bodies. I want to make decisions and choices in my life. That's why I have placed these pieces of fabric and buttons to symbolize my choices and my ability to make decisions for myself. These are some of the many stories that were shared. And this fabric that you see here today is a reminder and symbol of resilience, hope, and peace. Statistics and data often makes the affected individuals invisible. The global data says that 1 in 3 women have faced some form of partner or non-partner violence in their lifetime. 1 in 3. They are sitting amongst us. They may be us. We see them every day on the roads, in the grocery stores. And these are the stories of these 1 in 3. And there are many, many more untold stories. Peace and violence cannot coexist. And one tool or approach to talk about this form of violence that often remains invisible in our community is art. Communities have used this as a tool of storytelling and to communicate the impact of various social issues for a long time. And I would like to share with you some examples. This might be something that most of you are familiar with. In the 1980s, at the peak of the HIV/AIDS epidemic, this quilt was created by community members. It was a way of channeling the national anger and grief and loss families and individuals experienced. And till today, this remains one of the world's largest community arts projects, acting as a massive living monument to the lives lost to the HIV/AIDS epidemic. This was first displayed in October 1987 in the National Mall in Washington, D.C., featuring 1,920 panels. That is 1,920 stories, 1,920 lives lost. Here's something very close to home, right here in Durham. The Durham Homicide and Victims of Violent Death Memorial Quilt. This is an accounting of every murder victim in the Durham County since 1994. And as of late 2024, it consists of over 1,000 panels, which is about roughly 33 murders every year. This is an art initiative led by an artist and collaboratively done with the community. Fabric tells us a story. It's a form of legible data. It tells the story behind numbers. 1,000 might look like just a number, but 1,000 pieces, panels on a quilt tells us a story and communicates the impact. With this piece here, I want to call you to reflect and see an alternative form of peace building that is through art and other community-centered processes. While peace building can happen in the United Nations, in national and international organizations with big project proposals, million-dollar budgets, and large infrastructure and experts, it's also important to include in peace building local communities and those directly affected in creative and therapeutic ways. Art is one such creative and therapeutic tool that can bring communities together to heal trauma and to create peace collectively. It is also a community-based research tool that can create opportunities for the real subject matter experts, that is the affected community, to engage in knowledge production and research. Art is healing. Healing is in the movement of our hands and creating what we envision. Healing is in the expression of our pain and grief in creative ways that gives a new meaning to it. Healing is in the memorialization of the pain and grief and sharing it with agency and autonomy. Till I came here, I did not know that this form of knowledge production and research is possible. I did not think a hobby that I had can be a tool for peace building or a community-based research method. The School of Social Work taught me how I can engage the people I work with in an empowering way that recognizes their agency and autonomy. And I want to recognize Dr. Shoa, who taught us this in our class, and someone who made me think more about engaging communities. The women I worked with shared with me how difficult it can be to seek support for domestic violence. And because the process of seeking legal services, safe shelters, custody for children, and immigration processes often feels like they are losing their self-respect and dignity. These experiences tear them apart, but they choose to rebuild and feel whole again with the support of organizations like Kiran. Today, I call on you to look at healing-centered approaches as a form of peace building in your projects and programs. Invest in art-based and creative approaches as valid tools for trauma healing and peace building. Provide flexible and long-term fundings that allow grassroots organizations to respond to real needs of the community. Direct resources to organizations like Kiran that are led and serving affected communities, not just larger institutions. Today, with this sari and these stitches, I, along with these women, reclaim our identity and narratives and experiences of gender-based violence and discrimination to tell our stories with agency and autonomy. And I call on you to create such spaces in your clubs and communities. The quilt I produced with these women, this quilt was mostly curated by me, and the artwork was done by the women I work with, will be displayed outside. And I invite you to stop by and reflect on these stories. Thank you. Oops.
You always know when you end the program with a Brazilian that they're just going to start dancing. We're switching out the slide deck, so it'll just be 1 second. So why don't we all stand up for a 7th inning stretch?
Hello.
All right. Let's raise your arms up.
Hello.
Take me out to the ball game.
It's work? It's on. Is it?
Yes.
Okay. We need. I'm good. I know removing this over the mail.
Okay.
We start praying now.
Lillian, are you ready for us? Okay. The final presentation.
Well stretched out. Oh my. Okay. Good afternoon, everyone. Yes, give me your energy, please, because I really need it. Okay, thank you. My name is Lillian. I'm a Rotary Fellow from Brazil. I'm a humanitarian, an educator, and a mother of 3 wonderful children. And they're sitting right over there. And Amani, thank you for being quiet, okay? For the next 12 minutes at least. So today, I want to speak about an urgent crisis affecting children around the world, and about an unexpected and powerful tool for restoring their protection and well-being: social capoeira. But before we begin, I'd like to ask you a simple question. When you think about your own childhood, what is one memory that makes you smile? Just take a moment. Maybe it was playing with your friends, being near someone you loved, moving your body freely, or going to school. But today, millions of children risk not building those kinds of memories. According to UNICEF, 473 million children grow up in areas affected by armed conflict. That's 1 in every 6 children on the planet. Not statistics, children. War is a disruption of childhood. The artworks I'm going to show you were made by refugee children living in Dzaleka refugee camp in Malawi, where I lived and worked for 5 years before coming to Duke. One child drew a landscape with the sun shining in the background, but in the foreground, militias attacking the villagers. And one figure says, "I am a killer, and I don't want you to be happy." Another child, a young refugee poet, dear friend of mine, he wrote, "I can't forget this war. I can't forget the bullets falling like raindrops in the rhythm of rumba." These children, they are trying to make sense of experiences that no child should endure. In conflict, nearly every right guaranteed by the Convention on the Rights of the Child becomes fragile. Children may face physical injury, sexual violence, loss of caregivers, forced displacement, disruption of education, coerced recruitment, trafficking, and other types of exploitation. And these risks accumulate. But research also gives us something hopeful. Children are not only vulnerable, they are also resilient. And resilience grows when certain protective factors are in place, such as strong bonds with caregivers and other trusted adults, social support from peers and community,
play and artistic expression, connection to spirituality, a sense of agency, and altruism. Whether a child develops vulnerability or resilience depends on the interplay between risk and protective factors. And the good news is that targeted interventions can tip the balance. And in my experience, programs that strengthen protective factors, they are the most effective at building resilience. Over the years, I kept noticing what these programs had in common. And they were family-oriented and intergenerational. They were focused on the web of relationships around the child. They were community-centered rather than individualistic, strengthening social bonds and collective healing. And they were artistic and playful, giving children ways to express what words alone could not capture. And this made me reflect on something very personal. I grew up in Brazil, a country where music, movement, and community are central to how we show up in the world. I have always known that culture and community could heal. But it wasn't until more recently that I discovered how one particular Brazilian tradition, born from the margins of our history, could embody everything I just described and become a tool for child protection, psychosocial healing, and community peace building. And this tradition is called capoeira. Oh, okay, we're a little late. For those who may not know, capoeira is an Afro-Brazilian art form created by enslaved Africans during colonial times. It was their response to the greatest form of violence in human history, a way to resist and preserve cultural identity. It blends movement, music, and ritual. It is deeply community-based. And when these elements are intentionally combined to support children affected by armed conflicts, it becomes what we call social capoeira. And today, social capoeira is being used with children in different parts of the world, as you're about to see. How do they do that? What you just saw is from a Brazilian organization called Gingando pela Paz, literally Sway for Peace. They developed social capoeira, adapting this Brazilian martial art to help children heal. The seed of Gingando's work was planted in Brazil in 2005. In 2008, it traveled to Haiti, where it took root and grew strong. And by 2014, its fruits reached the Democratic Republic of Congo, working with children demobilized from armed groups, survivors of sexual violence, and displaced children. But to understand what social capoeira is, we must begin with the circle. The circle in capoeira, or as we call it, a roda, is more than just a physical formation. It's a philosophy. In the circle, everyone sees and is seen. No one stands above others. Everyone participates and is celebrated. For children who have experienced violence and broken bonds, the circle creates a space to rebuild trust in others and in themselves. Social capoeira is powerful because it combines several healing elements at once: movement, music, and play. Whether we have experienced violence, conflict or not, we know this truth. Trauma is not just stored in our minds, it's stored in our bodies. And as an embodied practice, social capoeira helps children process trauma in nonverbal ways. Many children cannot narrate trauma, but they can move it. Social capoeira is also a multidisciplinary program. Not just sport, not just art, and not just therapy. Regular dialogue circles engage children, youth, and families in conversations about nonviolent conflict resolution, children's rights, gender equality, and positive masculinity. Now let me show you how the methodology is structured. Gingando's work unfolds in 3 stages. The first stage creates a safe and protective environment around the child. Through capoeira practice, music lessons, and dialogue circles, children reconnect with themselves and others. At the end of this stage, there is a rite of passage that's called batizado, or baptism. And this matters because in many armed groups, initiation rituals are used to rupture a child's identity and create a new self based on violence. Capoeira uses a rite of passage to do the opposite. The child receives a new name, reflecting their strengths. It marks a symbolic rebirth. In the second stage, children and youth begin to grow into this new identity. They recognize their strengths and continue developing personal and social skills that support their own well-being and that of others. In the Democratic Republic of Congo, Gingando built a training center where young people access leadership programs, civic education, and vocational training, preparing them not just to heal, but to become the next generation of social capoeira educators themselves. And finally, the process expands outward. Children take what they've learned back into their communities. They lead public capoeira circles, raise awareness about rights, and help protect others. They don't remain beneficiaries. They become agents of protection and defenders of peace in their communities. And the data backs this up. Over 7,600 children reached since 2014 in the Democratic Republic of Congo. 90% of girls want to become leaders and help others. 100% of participants associate their well-being with social capoeira. And 100% show improved behavior according to their parents. Gabriel, we need to enroll these children. Gabriel is my husband. This is a methodology that works. But behind those numbers are real lives. Wisner, a young participant, put it this way: before joining capoeira, things were difficult for me. I didn't know how to control my emotions. Capoeira changed my life. We work where there is war. We create peace. As a mother who sits side by side with children who have endured what no child should, I know that what was broken can be restored. I've seen that happen. If violence dismantles the circle of protection, then we must rebuild it. And Rotary knows how to build circles, right? Who is here for the second time or the third time? Yes, that's a circle of protection. And I feel very safe here, don't you? So now, let me give you the good news. This work is closer than ever. This year, I'm helping bring social capoeira to New York City. Who is from New York? For me, this is a continuation of the path I've been walking as a peace builder, supporting children facing violence, whatever form it takes, marginalization and exclusion, to reclaim their dignity. So here's how you can help. First, Connect. If your club or district works with youth or community programs, help us open doors. Scan the QR code to connect with Gingando. Second, fund it. A single grant could help bring this methodology to a new community, whether in Africa, in South America, or right here in the US. And third, experience it. Step into a capoeira circle in your city. Scan this QR code to experience capoeira right here in Durham, while you're around. You will understand in your body why this works. So I'll leave you with this question. Will you help us rebuild the circle around our children? Thank you. Muito obrigada. Legal. Ah, não, eu sei como fazer. I should just done it before.
It's on. Okay. All right. We're going to start in an embodied way. We're going to sway for peace. All right. To the left, sway. To the right, sway. I just want everyone to know that we are people who love each other enough to be able to do this impromptu. They had no idea. All right. You're sorted now. Okay. Love these kids. My name is Adme. I go by Adme. It's the only name, so please call me Adme. I am one of the faculty directors, along with my beautiful comrade in arms over here, Suzanne Memo. I'm the faculty director for the Duke side of this Duke-UNC Peace Center, but I say go blue, both colors. So I'd like to say, in terms of thinking about what these beautiful people have put in front of us today in this very last panel that John named Healing the Injured, that one of the things they do so beautifully is to be very real about the injury. That this is not what Hafiz has called peaches and cream approaches to human rights. Right? To the right that people have to be whole, to be held and protected. And so one of the things that I love about each of their presentations is that they show us the brokenheartedness that each of them have dwelled in. So I want to remind us of that brokenheartedness. Charmaine, the way you talked about the weight of Shina's mother literally breaking her. Hafiz, the 36 hours and how you sat there broken, exhausted, with the blazing gold and green field behind you. Pris, the way you talked about the shattered lives and what it was like for you to create the conditions in which people could be talking about wholeness together. Lillian, I will never forget that picture of the sun in the background and in the foreground, someone saying, I'm not here to make you happy. I'm here to kill you. No joke. No, like failure to see the brokenheartedness here. I'd actually like to quote Lillian when she said, if violence dismantles the circle of protection, then it falls to us to rebuild it. This is what I love about our Peace Fellows, what I love about this program, is that we bring people here who are really making it their purpose to rebuild it. And they're picking up on what Khalid said so beautifully. Keeping hope alive for someone else is what we do. Where'd he go? And that your hope is not something you can feel on your own. You really need each other to do that. Debbie, we come home to relationships. So of course, this is the answer that these beautiful people give us, that in the response to this brokenheartedness, as people literally mend the brokenhearted, we get the story from each of them. Let me start with Lillian in this case, right, where it's a battezado, where a person's identity has been ruptured. They get a new name based on their strengths. They come home to themselves in relationship to others. In the case of Pris, here you have a quilt of the wholeness where people can literally say to you that this is home, that they've made it, that they find comfort in each other as a unit and as a group of people together, thanks to what you pulled together. Hafiz, you gave us the language. The first circle of peace is the family, the traditional family, the chosen family. And Charmine, everybody is crying when they think about your mother and the rock solid foundation of love that you have carried forward from her. Thank you so much, all of you. The question I'm going to pose with that prerogative of being a moderator, and then I really do ask, if you want to ask these beautiful people a question, please indicate so that you can get the mic. What is it about the work that you've just presented to us that inspires you? And how will you carry that inspiration through whatever you do next?
Usually it's ladies first, but okay. What inspires me is how simple the core question is, and obviously there is a caveat to that. We send people into the hardest environments on earth, and we don't ask who's looking after them. That's not a funding problem, that's essentially a design problem. And the evidence says we can start fixing it. Gillen's changed how I see that. I came in thinking about individual patients, and I'm leaving thinking about systems. Probably that's the most abused word today, so I'll just say frameworks. That shift is what turned this presentation from a personal story into something I think has legs. What I want to do next is keep working where mental health meets public health, meets the well-being of children and young people, because the earlier you intervene in these cycles, the more you change. The first circle isn't just on architecture I built for a conference. It's how I want to approach the work from here.
What inspires me is mostly the work on gender that I've been doing. I was pretty young when I realized that there was discrimination based on gender. And as someone who always said, oh, you can't tell me to do something because I'm a girl, was always my way of responding to my parents. And I had parents who accepted that and who were like, okay, they'll never use the word, you do this because you're a girl. That was never used at home, because they knew the moment they said that, nothing was getting done. But I saw how things were different for so many women out there. And also with me, like, even though I had progressive parents, but I had extended families that often restricted, had rules, would say things. So when I was working with community, what I realized was there was a big problem with gender. Like, this was a problem. Like, women were controlled in so many ways that men weren't controlled. And I experienced it personally. And that's kind of what inspired me to step into the work of gender. And that made me realize and think about choices. How many women have the ability to make choices about their bodies, even to get a tattoo, to get a piercing. And that expands to more further into reproductive choices. So how I saw that these are important choices that women and anyone need to be able to make about their bodies. And that's kind of what inspired me to do the work I did. And coming here, the perspective changed more into how I can work in a more healing-centered way. Mostly my work was around advocacy, policy level work, trying to kind of make noise, tell people, this is happening, you need to listen to me, but also coming here helped me see how communities are harmed by this. And I think that's what I want to continue in my work, to explore how this can be healed and how we can also make change in the community level.
You. I'll try and keep it brief. Just to, what inspires me about the work is that when I came to North Carolina on the Peace Fellowship, I came with burnout. I came with watching how I kept writing about people behind bars, but I couldn't see the impact of my work, and that left me very disheartened. But when I came here, thanks to Rotary, I went for my AFE to California. And in the hills of Santa Cruz, I spoke to people who were formerly incarcerated, people who were now actively working. A person who was once accused of sexual violence now held a small 6-month-old in his hand. And I asked him what made that change happen. He said that he was on this path of self-destruction and violence. And then one day, through prison programming, he wrote a letter of apology to his family. And his siblings came and told him that we still love you. And that one thing completely changed him. The next 15 years he spent with a blink of an eye. It went by, he came out, and then he had a family, he had a baby. And I thought that this was not possible. I could not believe it. And then I saw another and a third and a fourth. And that completely changed my view of the world. The closer I went to the system, I saw how much it was harming the people, but I saw how much agency they practiced, how much they resisted every single day. And I want to continue my work alongside these women. They give me so much of inspiration. And that's where I want to be. I want to be where the change is. Thank you.
I'm really inspired by children's culture. So working with them for me is not just in service of them, it has a deep effect on my own healing. And this needs to be said. So I have found great masters in the little ones. They are capable of doing great things and remembering of things that we have forgotten. And above all, I think anyone who could picture a baby, just like a newborn baby, would agree that there is so much dignity, there is so much worth in that small life. And it really pains me that over time, children, they grow to forget that sense of self-worth. So I think it's both a motivation and a reward that I get from this work. And I will definitely carry this forward, regardless of what I will be doing.
Thank you all so much. I keep thinking about your beautiful quote from Wisner, "We create peace." Like, we do it. So we also create a conversation. I'm wondering who would like to start the conversation. Anybody? Thank you. Go ahead.
This is for Charmaine. So you spent a fair amount of time talking with people about families in prison. What do you think the purpose of the prisons is? What is that about?
My understanding is that it is a way to keep people outside safe, and it is to end violence. But if our response to violence or harm that has occurred is another cycle of violence, then the cycle keeps continuing and doesn't break. Out of the 1.9 million that I mentioned of Americans that were incarcerated, more than half of them are parents. So I think if we want to end the violence, we need to in some way make make the system more productive instead of creating more and more violence. Yeah.
Anyone else? Do we have any from online?
We do.
Okay.
For Hafiz, what was the hardest part about learning to let your support system in? And what advice do you have for peace builders who are used to being the strong ones?
The hardest part was that I didn't have a model for it. Nobody in my life had shown me what it looks like to be competent and vulnerable at the same time. I thought those were opposites. They are not, but I had to learn that the slow way. My advice is simple. You don't need to overhaul your personality. You just need one honest relationship, one person who sees you without the armor on. Start there, and you can build outwards.
Beautifully said. Is that you, Laura? Go for it. Did I hear somebody else murmur you want to ask one? Okay.
Not hogging the mic if no one's raising their hand. So I know for all of you, you had done incredible work in difficult circumstances before coming here, and this has been a time to restore your motivation and rejuvenate yourself before you re-enter the field. And so what practices in your own life are you hoping to carry forward from this experience as you go back to front-facing work in those conditions?
Lillian, will you go first?
I think I was probably less burnt out and stressed when I was working in emergency contexts. No, but okay, it was a joke. What I really want to carry forward, I think, is this sense of having the trust in the people that surround me, even if from a distance, because we have built such strong human connections here. People that I would probably have never met in other circumstances. So I would very much like to carry this with me wherever I go. Having their trust and their presence in my life is something that that will definitely help me in the type of work that I do. And even if we're not in the same place, I want to be able to, you know, reach out to Sharmeen, Hafiz, Priscilla, and all of us and say, I need a shoulder, I need an advice. So that's something that we developed here that happened quite organically. So I think it will all, as we go forward, it will follow us wherever we go.
In addition, in addition to what Lillian had to say, my host family is here, Vandana and John Varasila. I have learned as much from them as I have learned from academic articles. I learned from them to show up for people in ways unimaginable. And I'm taking that spirit of positivity and hope from them. Every single day, I have seen them endure so much and then just show up as if nothing happened and everything is going to be fine and be there for me as I have seen my professors do and the Rotary family do. So that's what I'm going to hold closest to me, the hope that there is so much of love in this community. That's what I'm going to take with me.
I would also add to all of that because
And
the different diverse perspectives that I learned here, especially from my fellows and even from framing this presentation. I remember the first day I took this presentation and how much of questions and perspectives I got on it. And from what it was to what it is today, I saw how it was refined. And sometimes having this kind of knowledge and input, and someone who's not in your field look at it and say, oh, I think you're missing that, or maybe you should add this. So I think that kind of perspectives that you get from your colleagues and friends here is so great. And also how that has changed my perspective in very different ways, because engaging a community in a meaningful way was something that I never thought could be done as simple as this. But the learnings here changed. So I think that's what I'm going to carry the most.
For me, I came into this program as a physician. So basically that meant that my entire wiring is through the natural sciences lens. And having been placed with individuals from different backgrounds who don't necessarily see eye to eye, but who share the same goal of building peace, we have learned how to disagree agreeably. And that's one thing that I feel is missing from the discourse, because we have come to such a polarized world that having a conversation has become difficult, and you have conversations with people that you do not necessarily see eye to eye with, right? You gain something new, you add perspectives that you have not probably encountered before, but you do so with an open mind. So I don't say this lightly, but honestly speaking, some of the relationships that I have built here, I will cherish them for life. Some of them, I hope, will continue with me after this fellowship ends, right? But they've all left an indelible mark, and I have changed, hopefully for the better.
oh, so much for the better. So I know that I saw Bill's hand, and I had the great fortune of being in a circle with Bill yesterday, so I'd love to hear what you have to ask.
Incarceration. The United States is one country in a lot of states that allow for private prisons. As a private prison, the prison is a for-profit organization. It has stockholders, and its purpose is to make money for the stockholders. Its purpose is not to rehabilitate and send inmates out into the world. So my question is, did you come across research, did you come across situations where that is actually maybe the reason for the high number of inmates in U.S. prisons?
Absolutely. Thank you for pointing that out. But I want to add that it's not just the for-profit prisons, it's basically the companies that provide services to all prisons. So whether it is communication services, whether it is the companies that make pay for the bail bond, whether it is companies that provide other peripheral services. So even the halfway homes sometimes are owned by people who are affiliated with the prison system. And that's why the organizations that I witnessed in California and even Restorative Justice Durham in that sense is trying to work independent of the prison system. They are trying to seek reformation within community, and they're trying to do it using mediation and other community practices. And
in their words, I see so much of promise in what they're trying to do. One of the obstacles that they face is that there is very less funding in remedying the structural violences that these families face. So if I take accountability, if I've caused harm and I take accountability today, I return the purse I stole, but I am still left without food to eat. And that's where ideally, if the money went, we'd be able to stop the violence. Yeah, thank you.
Well, I want to say thank you to everyone. Thank you so much for being here for this final panel. And thank you to the fellows for making it worth it.
We're now going to transition to the awarding of the ceremonies. Yes, we'll move those off. Suzanne and Ame, could you come up, please? Ame, we're gonna. It's been a tremendous time today. Thank you so much for giving your time today to see and hear these 12 scholars present, Peace Fellows, and then also to the other 9 this morning who had their poster sessions out there. Those posters are still out there. You'll see the quilt that Pris promised is hung up there as well. But now this is really the culmination where we award each one of the graduating fellows their Rotary Peace Center certificate. So we'll take turns here.
Hanan, Kadi, Abafita. Okay. Okay. Priscilla Arubraga Sam. Tibab Abate Asfol. Oliver Ebor. Okay. Mohammed Samir, Mohammed Bakri. Dang. Sharmeen Hakim Indowarala. Yours, all of the Carolina. Beauties. You gotta read some of these. Debbie Caramel. Abdul Hafiz Mohammed Kadir. I'm sorry. Okay. Vishal Karal. Rory Newberry. Khalid Shah. Lillian Villanova Castellavalt.
Here we have one more round for the class of 23. We have one more final speaker. Holger, thank you for coming on behalf of the foundation. Patrick, thank you for coming on behalf of Rotary International. It's your support, the systems that support this, but the systems are made up of members. And thank you for the members here from Rotary who have supported this for 25 years. You see the results. So to close us out, we have the tradition of we always ask the fellows in the graduate class to choose one speaker to make final comments, and that is Lillian.
Here I go again. Now it's time for the dance. Just remarks. Okay. We made it. Yes. Thank you to everyone who has joined us today, both in person and from around the world. You made us feel very special and loved. And this is not an ending, because a circle has no end, only renewal. But before we step into what comes next, I would like to return to the question that brought us here. What does it mean to build peace from the margins? Today, 12 incredible peace leaders that I'm honored to call my soul sisters and brothers, they have showed us. Peace is being built in health systems, in community gatherings, in civil society activism, in the earliest years of life, in artistic healing work, in ethical conservation, in supporting prisoners' families, in caring for the peace builders, in educational initiatives, in a capoeira circle, and under a tree. None of these spaces are the center, yet all of them are essential. We chose this theme because margins carry a double meaning. Margins are the structures, the limits, the borders that allow some to thrive more easily than others, move more freely, be safer, be the default against which everyone else becomes the other. Through this program, we learn to see peace as the transformation of these structures, so they no longer produce the violence we then scramble to contain. But margins also mean the periphery, places away from the center. And this is where the fellowship transformed us. Many of us arrived believing that the best ideas and models existed elsewhere, far from our margins of the world. What we discovered was that the true richness of this education lies in what happens when people from very different worlds sit in the same room and actually listen to each other. We were humbled by our professors, mentors, and fellow fellows who engaged deeply with our experiences and worldviews without ever asking us to conform. In being ourselves and saying our truths, we learned from everyone. And that made us stronger than ever. And the transformation didn't just happen in the classroom. It happened on a bus ride between campuses that turned into live conversations. In the moment when someone's story broke you open and rebuilt something inside you. When a person from the other side of the world somehow understood exactly what you meant. When people you barely knew made you feel seen and valued from the very first day. Looking at you, Rotary Peace Center people. This fellowship is not just an academic program. It's about human connections and how they transform who we are. The world we're stepping into is not more peaceful than when we started. Some of us have watched conflicts escalate in our home countries. We have lived through fear, uncertainty, and powerlessness against forces much larger than ourselves. This program did not shield us from the world. It asked us to face it while holding on to each other. And it is in this holding on that we find our strength. Peace is built by ordinary people who choose again and again to care, to listen, to repair, and to reach beyond what feels comfortable in service of something larger than themselves. And that is the Rotary spirit. That's why we're here. Because generous Rotarians who never knew us before believed in our work and our potential and funded this fellowship. In this work, none of us is optional. All of us are central. Today, we celebrate how far we've come, and we will recognize that none of it was possible alone. As our friend, Mr. Physician Hafiz, beautifully put it, the peace builders' resilience begins with the family. So we thank first and above all our families. Children, partners, mothers, fathers, brothers, sisters, everyone we call family. Our achievement today is dedicated to you. To the friends we made along the way, thank you for holding our tears and giving us reasons to smile. To our Rotary host families, thank you for extending your hands and opening your hearts. To our Duke-UNC Rotary Peace Center team, John, Tom, Susan, Suzanne, Ame, Sharon, Francis, Alex, Randy, Newman, Christina. You guided us, you grounded us, and you believed in us, especially on those days when we lacked confidence and faith that things would be all right or wouldn't be all right. To our professors, staff, classmates, thank you for your wisdom and your care. To Class 22, who showed us the way and inspired us, wherever you are watching us now, and to Class 24, who have quickly found a place in our hearts. We are so honored to be part of this shared journey. And we can't wait to see you up on the stage next year. And to the Rotary Foundation and Rotarians everywhere, you made all of this possible. What you invest in is more than just a fellowship. You invest in a belief that peace is possible, that is built through human connection, and that ordinary people, given the tools and trust, will rise to the occasion. And as the great Brazilian thinker, Paulo Freire said, education does not transform the world. Education changes people, and people transform the world. You changed us. Now let us get to work. Thank you.